So good afternoon, everybody, and welcome to what is the 15th time that we've met as the West Yorkshire Health and Care Partnership Board. As you know, this is part of our shared mission as a system to join up our services and make sure that we support and invest in ways that meet the current and future needs for health and wellbeing of people in West Yorkshire and Harrogate. We've a particularly interesting agenda today, where, as well as the update report from our Chief Executive Lead, Rob Webster, we have an update on progress against the Tackling Health Inequalities for Black, Asian and Minority Ethnic Communities and Colleagues review. We have a paper describing the arrangements we're making for the adult social care discharge funding, and particularly importantly, the first draft of the partnership's 5-year strategy, which builds on our shared previous forward plans. And then a paper that looks at a set of common actions that we could be adopting across the system to mitigate the cost of living crisis, which we recognise is going to impact on both our staff and the wider population, and of course has huge potential impacts in terms of health and wellbeing too. We're continuing at the moment to meet remotely using Microsoft Teams, and to make sure that the meeting is available to people both as a live link and as a recording. And we do also have an opportunity for questions, and we have one public question to take shortly. We will have a short comfort break at one point during the meeting. And as ever, I'll remind people, if you could mute your cameras when you're not presenting or speaking. Sorry, mute your microphones when you're not presenting or speaking. And when you are speaking, do have your cameras on so we can see you. And if you want to contribute at any point, use either the raise hand functions or the chat function, and hopefully we won't miss anybody. Just before we start the agenda items, just a couple of things I want to highlight. Firstly, congratulations to Richard Vaughtry, who's been appointed as the primary care representative to the Integrated Care Board since our last meeting. And also congratulations and well done to everyone who was involved in the partnership winning 2 national awards, and also being highly commended for 2 further awards by the Health Service Journal. Highest profile, of course, was winning ICS of the Year for the 2nd year running, where the judges recognised our partnership's strength in delivering its ambitions. We also won the Communications Initiative of the Year for the Root Out Racism, Anti-Racism Movement campaign. The Vascular Service was highly commended for Provider Collaboration of the Year, and the Children and Young People's Mental Health Service Inpatient Unit in West Yorkshire, based at Red Kite View, was highly commended in the Mental Health Innovation category of the year. I know that a number of other organisations and teams within the partnership were also finalists in various other awards. So well done to everybody involved. I suppose finally, before we start, it's also important to recognise that clearly we're meeting at a time when the health and care system is under huge pressures. I'm sure we will touch on that in some of the discussions, and particularly when we talk about Rob's update report. But we do need to recognise those pressures, and our thanks as always to all of our staff, colleagues and volunteers who are working so hard to care and support people in West Yorkshire in these extremely challenging times. So the first item on the agenda there, or next item on the agenda, is questions and public deputations. We've received notice of one question from Dr. John Puntis, and I think Dr. Puntis should be with us to ask his question in person. So
I am indeed. Yes, so can you hear me? Yeah. Yeah, so thanks as ever for the opportunity. I wanted to ask a question, or a couple of questions, in relation to the update from the Chief Executive and the financial situation facing the ICS. And I'm not going to say anything that I think you don't know already. I mean, the extra money in the autumn statement is clearly inadequate for the NHS to meet its objectives. And the NHS providers briefing, which is circulated with the papers, points this out, because it says in fact, it won't even cover the shortfall in budgets caused by inflation. So this is by no means a generous settlement. It's actually a cut. and the unrealistic calls for greater efficiency savings and elimination of waste simply distract from the real issue of chronic underfunding in the NHS. I also noticed that there was a reference to maintaining the momentum in the new hospital programme. That's important to me because I keep waiting to see progress in Leeds, where we have now a kind of building site, but with no building going on. And it's deeply disappointing that the momentum is being maintained, because the momentum is virtually zero. None of the 6 Pathfinder projects supposedly to be completed by 2023, which included Leeds, have actually been funded due to pushback from the Treasury. And there's actually no indication that this is going to change anytime soon. So my questions are whether the board understands that the public are increasingly aware of the huge gap between what is promised and what can be delivered, and ask, will it be honest with the public that making the savings demanded in the context of current funding mean that services will inevitably have to be cut? And I think this is really important, as otherwise the public wrongly blame the NHS itself for waste, inefficiency, too many managers, lazy staff, and spending money on treating migrants. All these things which commentators and uncritical journalists like to trot out all the time as an explanation for why the NHS is failing to meet demand and patient expectations. Thank you very much.
Thank you very much, John. Thank you for that question, and I do understand many of the points that you're making in there. I'm going to ask Jonathan Webb, who's the leads on finance, to give an initial response, and I suspect Rob may want to add some comments to it as well. So, Jonathan?
Okay, thank you. Thank you very much for the questions. I thought it'd be helpful to start with a bit of context around NHS funding. So whilst health spending has been protected from the reductions in most government departments over the last 10 years or so, real terms NHS funding hasn't matched the increases that we saw from the start of the NHS in 1948 through to the financial crisis in 2008. So I suppose that is part of the context that we're dealing with. What the autumn budget did do, though, was make a number of very clear commitments to put additional resources into both the NHS and into social care, which is, on the face of it, very welcome news for the partnership, given that the integration of services to support people and their lives is one of our key priorities and helps us deliver our overall objectives as the partnership. In terms of health spending power, an additional 3.3 billion was announced for both 23-24 and 24-25, so the next 2 years. And that did reflect the Treasury's assessment of non-pay inflation and assumptions around the NHS pay award in those 2 years. And I think it is what's clear is that is different from, it was less than the 6 billion to 7 billion that NHS England had initially requested from government. But that was driven by the inflation estimates at the time done by NHS England. The latest assessment is in line, or the latest 3.3 billion is in line with the latest Treasury estimates. And the clear NHS England view is the settlement, which is a settlement that leads to a real terms increase in funding next year of 2.6% on the basis of inflation assumptions, is sufficient for the NHS to fulfil its key priorities. And we expect those key priorities to be set out further in the National Planning and Priorities Guidance, which we expect before Christmas. And at that point, we'll consider the local consequences of that. You also asked explicitly around the new hospitals programme and progress in terms of the developments at the Leeds General Infirmary site. It should be noted, we've also submitted a number of other schemes for consideration through that funding stream. As with other systems, we are still waiting for information about next steps, both for funded schemes as well as new schemes. And we hope to hear from the Department of Health and NHS England shortly. Colleagues will have also seen the increase in social care funding, which through a combination of better care funds, direct grant funding to local authorities and flexibility on council tax increases provides up to 2.8 billion next year and up to 4.7 the year after. Despite those funding increases, we do and we will continue to face significant challenges in the next few years. Not just about money, but also about how the cost of living crisis is impacting upon the people of West Yorkshire, including our staff. The workforce challenges across health and social care, the increased need for services in key areas such as children's and young people's mental health, and also how we work together to reduce the number of people waiting and the time that people wait for planned care. So the way we will do that is through our partnership arrangements at West Yorkshire and in our 5 places. We've got a responsibility to ensure that every pound we spend gets the maximum value for the people that we serve. And we do this by bringing partners and stakeholders together through our place arrangements, through our system arrangements to make those decisions. We are clear, we aim to be clear with the public and our patients when we change services and we involve them in these conversations. None of this is intended to portray any complacency about the challenges that we face, more about the arrangements that we've got and the behaviours that we adopt means we're in a good place to have those conversations when times get tough. Alongside this, as ever, we will base our decisions and choices on insight from patients, partners and the public, and we will be open and transparent and make our decisions in public. So I hope this goes some way to respond to the points that were raised, although, as the Chair said, it's possible that other colleagues may wish to add their perspective. Thank you.
Thanks very much, Jonathan, and obviously we also share that written response with you, John, as well, and with others viewing. Rob, I know you touched on the spending review in your update report, so I don't know if you wanted to add anything at this point or.
I think Jonathan's covered it. I think Jonathan's covered it. I think our commitment has got to be to continue to do what we've done for the last 4 years, Chair, which is to have these conversations in public with the public and to ensure that, as Jonathan says, all of our choices are framed by evidence and insight from the public, partners and stakeholders. As I think was alluded to in the question, you know, we operate in a political environment where politicians make choices about the resources available. Additional resources have been made available to us. We wait to see what the planning guidance says about national expectations against those resources, and then we'll have a conversation about what choices that leaves us to make. But I hope Dr. Puntis feels confident that those conversations will always take place in public and will always be evidence-based.
Thanks, Rob. I think from 2 brief comments before I bring Chris in, I think the context of this is really important. I think Jonathan's point about the trend in health spending really over the period prior to COVID explains a lot of pressures now, and why simply focusing on the level of increase we might have year on year, which doesn't reflect that historic shortfall, is going to leave continued issues. Obviously, from a local government point of view, I think most of the West Yorkshire councils will be publishing draft budgets now or early in the new year, and that will set out the very real pressures that social care spending is causing for them, and the difficult choices that places also in terms of, again, public expectations, as you touched on, where increasingly people don't always understand the pressures that social care is placing on the rest of the services local government provides. Chris, you've got your hand up, I'll bring you in.
Yes, thank you, Chair. Just responding to John on the question of the delays in the new hospital programme. I'm a member of the Building Development Committee. The delays are John needs to be reassured that the delays are a source of frustration and disappointment. We continue to press very hard Leeds' case. The changes in administrations have not helped. But as I understand it, John, we're expecting an announcement on the new hospital programme as of the 6th of December. So I hope there's some news there that's positive. We'll see.
Well, thank you for the responses, and I know that you share my frustration. I share your frustration. Thank you.
Thank you, John. Thank you for the question. So I'll take us on then. Item 43, declarations of interest. Again, just to remind members and colleagues to declare any interests that aren't already covered by existing registered in any particular item. And then take straight on to item 44, minutes from the last meeting and the action log. And unless anybody's got any queries with the accuracy of the minutes, I'm not seeing anyone, so I'll ask Ian to take us through the action log. Ian Holmes, thank you, Ian.
Yeah, thanks, Councillor Swift. There's quite a few actions on the action log, but fortunately most of them were closed between the meetings. So what I might do, if it's okay, is just where there's an open action, ask the lead for that to give a very brief update. And Kim Shuttler, there's a couple relating to the Harnessing the Power of Communities programme. So I'm looking at 01, 22, 23 and 11, 22, 23, which are about the sustainability of the sector in relation to COVID and the current cost of living crisis. I don't know if you've got a quick update on those two actions for us, Kim.
Yeah, happy to respond to that. I'm Kim Shuttler. I'm the SRO for Harnessing Power Communities and the member on the ICB. So this is obviously a topic that is burning for our sector and therefore for the system. So it's been identified as a high risk for us. We have been working very closely with the group that have been looking at the cost of living and poverty work. So I think that will come up later on the agenda. But so there's some recommendations that are embedded already within that in terms of sector sustainability, which if agreed would make a significant difference. We've also been working to look at some key recommendations that we're bringing to place in terms of things that would recognise the challenging financial context, but some things that could be put in place, which would support the sector sustainability. So that is moving forward nicely, and I've had some responses from some of the areas who have shared what they're doing. In terms of the piece around workforce, Kate might want to come in, but there's some useful conversations going on in the People Board around volunteering, how we might support the sector in terms of improved some enhanced leadership and governance by supporting people to join charity boards. And then the final piece, which is probably still an outstanding action, but something that we're keen to discuss, is how do we make sure that we have got robust VCSE infrastructure in all of our places so that they are well set up to be able to mobilise and act and enable the sector to sort of fulfil its greatest potential within the partnership, particularly going into this challenging period. So happy to take questions, but I think we're progressing it and obviously would very much welcome the ongoing engagement of places in helping us to move those recommendations forward.
Thanks, Kim. Kate?
Thank you. I'm Kate Sims. I'm the Director of People for the ICB. Good to see everybody. Just to enhance, as Kim said, had some really useful discussions and planning with Kim, but also with Joe Baker in terms of the workforce aspects, Chair. And in particular, at the People Board in October, there was a presentation and support around the principles of volunteering, which looked very much at two aspects, both the volunteer experience and enhancing that, and also the management support around this. So the sorts of things looking at breaking down any barriers to people who might be interested from a volunteering point of view, making sure that volunteers receive that training and support that's so necessary. And from a management point of view, identifying any of those sort of career progression aspects. And as Kim's already indicated, another area we're looking at is around volunteers at board level across a number of the VCSE organisations. And they are repeated conversations as well through the People Board. Thank you.
Thanks very much.
Yeah, and then there was a couple for you, Gary, relating to the Health Watch Insight report from September. So 4 22, 23 and 5, 22, 23. I don't know if you've got a really quick update on those, Gary.
Yeah, thank you. Thanks, Ian. Hi, everybody. I'm Gary Jevon. I'm the Chief Executive from Healthwatch Wakefield, and I'm representing the Healthwatch network across West Yorkshire in this board meeting. I think I'd just like to raise everyone's awareness that the Insight report presented at the last meeting was a collation of themed intelligence and multiple items of feedback from multiple reports and multiple projects from multiple organisations. So it's nigh on impossible to identify exactly which demographic groups and communities contributed specifically to that particular report. However, I would like to confirm that Healthwatch's bread and butter operations is to work really closely with groups of people with protected characteristics and in disadvantaged communities, and they will always feed into all the work that we do. Each individual Healthwatch will collect its own demographic information based on whichever projects and activities it's doing. At the moment, I know that within Healthwatch Wakefield, we are currently re-benchmarking that demographic process against the new census outputs to make sure that we're being representative of our communities. And I'm sure that the other Healthwatches across West Yorkshire will be doing exactly the same. But if anybody wants some more generic information about which demographics and which groups we work with, then please do get in touch and I'll endeavour to collect that information across the network and get it to you. Thanks, Ian.
Great, thanks, Gary. And then James Thomas, there was one for you around taking the diabetes recovery project through the clinical leadership groups, I think.
Yeah, no, thanks, Ian. So my name is James Thomas. I'm the medical director for West Yorkshire Integrated Care Board, and good to see everyone. So yeah, this is just picking up on the discussion we had last time, in which Stephen Cleasby from Calderdale discussed about the diabetes recovery project in Calderdale and how they were using cohort of people with learning disabilities with type 2 diabetes to focus in on that, and could we look at expanding that both in terms of geographically across the ICS, but also in terms of other conditions like epilepsy and type 2 diabetes. So this is on the, so I've picked that up in terms of clinical forum. We're working through that with the clinical forum and hoping to present that back across the system at the West Yorkshire Clinical Forum and progress this, working with Stephen from Calderdale. So I could take that within the clinical forum, Ian, and can feed that later.
Yeah, great. Thanks, James. And then finally, 12, 22, 23, Fatima or Kenese, I don't know if you want to give a little bit of an update around the collection of the RES or the equivalent RES data, which is an action for all by December, but I don't know if you want to come and just give a bit of an update on that.
Shall I kick off, Ian? And then I'm not sure if Kenese is here, but I'm sure if she is, I can see her now, she can contribute. So there were two elements to this. One was that we agreed the inclusive recruitment blueprint, which went to partnership board, and there was an ask for all organisations to adopt this. I have no intelligence that no organisations have not done so, but equally, I've not had any reports or intelligence of where we are with that. So that's something that we need to pick up. The other element about reporting and data in particular is something that we're continuing to experience challenges on. There's a couple of reasons behind that, just for the benefit of partnership board members. One is the fact that we don't measure the same things. So the Workforce Growth Equality Standard measures a number of indicators relating to the experience of our workforce within our organisation. Some relate to their experience of the public, others relate to the recruitment and selection processes that we have within our organisations, which is why we developed the blueprint. There is an ask of escalation to the board regarding developing some capacity to move this forward, and also an ask for some support to develop a task and finish group of colleagues from across the sectors to address some of the issues that I've just described. So if we could take that away as an escalation to the board and ask for some support of partnership members to maybe nominate colleagues to set up this TNF, I'm quite confident that we can move this along. But as you can appreciate, and you'll hear a bit more about that on the review update, we are starting to sort of have a bit of a delay on the reporting, which colleagues are concerned about.
Thanks, Fatima. So if people can take that on board, we'll look at ways we can support you on that message.
And that was it in terms of the Open Actions, Councillor Swift, unless anyone's got any questions in relation to any of that.
Can I come in, if you don't mind?
Yes.
So also we were thinking about how we can share and celebrate great examples. So maybe every 6 months, this comes up every 6 months for us. as themes 1 and 2. Maybe we can have volunteers from whichever sector to come along, and if they've checked their data maybe 3 years ago, and it might be on recruitment and they were in red for recruitment where it came to race equality, and they've moved on to green and they've done really well, there's going to have been a process they're going to have gone through to have got to green. And maybe we can have examples of them being shared, maybe just for 5 minutes at board every 6 months of different organisations, if people want to volunteer that, as well as working with the task and finish, because we want to be sharing the best examples and the progress that we are confident that is being done across the region on this work.
Okay, thank you. Thank you, Denise. Fatima, is that something?
Yes. Chair, I was literally going to respond to that. So I think what Denise is alluding to is a really important step in the work that we're doing as a partnership on this agenda. So what we're hoping and aspiring to do is, once we've got this task and finish group in place and we've got a grip of the data, it should give us a really honest reflection of where we are in a number of areas within the metric. What we can then start to do is what we do best in West Yorkshire, which is identify and celebrate good practice, but also within the values of our partnership, support some of the organisations which aren't doing as well, by showing what is possible, but also providing some practical solutions. So that is something definitely we can pick up. It may also be helpful to facilitate some sort of meeting prior to the board where we can collectively share that information as well, just so colleagues are cited before it comes to board.
Thank you, Fatima. Kathy.
Thank you. I think you all know me, but I'm Kathy Elliott. I'm chair of NHS West Yorkshire ICB, just in supporting Fatima and Kenise. Perhaps, Councillor Swift, we could share some information after the partnership, just a reminder of the kind of data that we're looking for, a reminder of the recruitment toolkit as well. And I support what Kenise is saying in profiling best practice case studies, as one of our colleagues here would say, that it's good to pinch with pride. So, and we can celebrate that practice as well, which directly supports one of our strategic aims on having greater diversity in our leadership in health and care, but also broader work that we're trying to do on tackling inequalities. So I'm happy to support Kenise and Fatima on that as well.
Thank you very much, Kathy. Yes, we'll act on that as suggested. Okay, I'll move on, if that's okay, to the next item, which is Rob Webster's partnership report. So, Rob, over to you.
Thanks very much, Chair. So I'm going to just give you a couple of points of emphasis from the report. People have had it, and then a couple of updates. And in doing so, I will bring in Bev Geary, our chief nurse, who's going to give us an update on Strep A, which I thought the board might find useful. And I'm also going to ask Kate Sims, the Director of People, just to give us an update from the People Board. She's touched on a couple of issues already, but I thought it was important to do that. You'll see from the paper and from the conversation so far that we've had the autumn statement from the Chancellor, who's the former Secretary of State for Health, one of the longest running Secretary of States for Health in history, I think, who's got clearly an interest in what we're doing. And we've talked about the additional resources that are being made available. This all comes on the back of a lot of political change and changes in the composition of the government over the last few months since we last met, some of which has had an impact upon the potential for the cost of living to become more difficult for many of our residents. I think you can read the report, but I think the key point I wanted to make at this juncture was throughout that period, the mandate under which we operate has not changed. So we've been operating under the same mandate from NHS England as an integrated care system to deliver the same standards and targets throughout. Now, what we're entering is a period, I believe, where we do now have some more stability in the makeup of the government. And as we've alluded to, before Christmas, we should be receiving a set of guidance on priorities for next year for the NHS. I personally hope that that will be something which is aligned with Local Government Association and other partnership bodies, because in the past we've had planning guidance, which has been a joint effort, recognising that there's work to be done across health and care, and it is the Department for Health and Care that we're dealing with. So we expect to see that, and I think that will trigger our planning work, where we need to take into account the resources that are being made available and the asks of us. That needs to be done in the context of, as I've said, the cost of living increases, and there's a paper later on the board about that. It needs to be done in the context of failings around housing in other parts of the north of England, which have led the Secretary of State for DLUC to write to all local authorities about housing. And because we've got a partnership that understands the wider determinants, you'll see we've picked up some work through our improving population health programme around housing to make sure that we're doing all the things that we can in that space. It needs to be done in the context of migration and Manston, and I wanted to put on record today my thanks to the people in the systems that have dealt with the dispersal of asylum seekers and refugees, people to our places in a very professional way, often at very short notice, often with not the best processes, but our staff, if ever you wanted evidence of why do we have a system, I think the way we dealt with those issues demonstrates the value of our system. So I wanted to say thank you to everyone who's been involved in that, and no doubt that will continue to be something that we're engaged in. And it needs to be done in the context of infections continuing to be a problem for us. So we know that COVID rates are reducing and now affect around 1% of the population. We know, though, that flu rates have been higher, as we anticipated in previous briefings, because of the position that we saw in the southern hemisphere. We knew we'd get a short, sharp, early flu season. And unfortunately, we know that other viruses are causing problems. So I just wanted to ask Bev Geary just to give us an update on what you'll have seen in the media around scarlet fever and strep A and how it's affecting children, what we should do about it. Bev.
Okay, thanks, Rob. My name's Beverly Geary. I'm Director of Infection Prevention as well as the West Yorkshire ICB Director of Nursing. Just in terms of strep A, as Rob said, you'll have seen in the media there's lots of conversations happening and information due to the growing incidence of strep A infection in children, and also those that are presenting with lower respiratory tract strep A infection in which is impacting on them and giving them and they're contracting scarlet fever as a result. Co-infection with these respiratory viruses are significant in comparison with what we've seen in previous years, and you will know that there's a significant increase in respiratory viruses this time of year. The UK HSA sent a letter into primary and secondary care with details as to what we should be looking for and what we should be doing, and the most up-to-date has been released and circulated to our system. There's also a UK HSA toolkit on its way. We met yesterday as West Yorkshire Director of Infection Prevention, confirming that everyone's received the most up-to-date information. It's circulated in each and every organisation and also in primary care. And they're giving messages to the clinicians at the front line as to what to look for and what to do and how to act. And they are monitoring the situation in each organisation. Communications have been shared to ensure consistent messages across our wider engagement network. Again, these are based on the UK HSA messages to ensure consistency. And we've just had a significant conversation in our West Yorkshire Clinical Forum. There's also information on our Healthier Together website for families, because as you can imagine, due to the increase in public anxiety, the numbers of calls to GPs, emergency departments and presentations to EDs and GPs and also to 111 have significantly increased. And 111 service has been on level 4 escalation over the weekend and since. So we will continue to share the most up-to-date information and messages across our system, and we will monitor the situation and incidents in West Yorkshire. Thank you.
Thanks, Bev. So I think one of the critical things for us all to do is make sure that people access the Healthier Together website, which has all of the best and most evidence-based information on it. People should access advice and support whenever they feel worried and concerned, and from an informed perspective. We know that this is a moderate illness for most people and responds very well to antibiotic treatment. So people being aware of it is a very positive thing. We need to make sure that people are aware based on the best evidence. So thank you to Bev and to colleagues for making sure that all of that's available. So that's obviously these sorts of developments cause public anxiety and increased pressure in the services, which are already under substantial pressure. One of the things I would hope we all continue to do is to make sure that our staff are not affected by flu or COVID, and therefore promoting the continuing vaccination of frontline staff right across the system. So in this context then of pressure, we're getting on with our strategy. Again, we're bringing an early version today to ensure that we're focusing on the right areas. And our strategy is built on where we are in the system in terms of delivery. And you can see from the paper, there's an outline of where we are across a range of sectors on delivery. Something that the Integrated Care Board and the Finance Performance Committee of the board have been strongly focused on, as have places and our institutions. I know every single one of the institutions represented here has a very strong focus on safety, on quality, and on delivery. We're doing well comparatively on resourcing and money against a very difficult backdrop. I think that's because of the amount of positive, open sharing of the position and the risks in the system that we face. And across the NHS and local government, I think we're in a position where collectively we will deliver our financial targets this year through some substantial work, and I suspect in council's terms through use of reserves, but next year looks incredibly difficult. In that context, the governance that we have is strong. We make good and effective decisions, I think. That's certainly what's being tested by internal audit, who have a positive view of what we're doing. It's worth mentioning that as we progress, there's a major review being commissioned by the Secretary of State for Health. It's important to understand it's a Secretary of State commissioned review, not an NHS England commissioned review, of how ICSs could be freed up from, I think, what's being described by others as micromanagement from the centre, so that they can focus on a smaller number of indicators and be left to deliver what local people require based on the context within which they operate, and do that in partnership. The principles of that are welcome, I believe, by all of us, and would require us to have good governance, good decision making, and good arrangements. So this is a helpful review. Many of us are involved in one way or another. There's a session today for ICSs, for example, with Patricia Hewitt, who is a former Secretary of State for Health herself and chairs an ICB. And I'm on an advisory group with Patricia, along with a number of others. There will be a call for evidence coming out shortly. The expectation is that the Hewitt review will say something about the same time as the planning guidance comes out, and then we'll produce its recommendations by the 31st of March next year. Final thing for me to say, I think, is that obviously all of this agenda, everything that we talk about, is about our people. We had a Children Young People's event yesterday in Wakefield with staff from all sectors, councils, the NHS third sector, people from communities, and Simon Mertz kicked off very nicely by reminding us that it's always about the people and the people. So we need to keep our people strategy in view. In future, we'll bring an update from the People Board here as part of the governance, because it reports here. But I wondered if Kate could give us a quick update on the position on industrial action and on people before we move on.
No, thank you, Rob. And yes, more than happy that we bring a paper. We have the 5 pillars, as you'll all know, of the people strategy, the people plan. And certainly as we go into 2023, the people board will be shaped into the themes of the pillars. So I think that would be quite a useful update. The latest meeting of the people board, the last one, was on the 11th of November. And there were a number of helpful sort of presentations against the people plan from colleagues. So just to give everybody a flavour of that, the Mental Health Wellbeing Hub, which is the West Yorkshire-wide system hub, was due to come to our tactical SLT, which is the system SLT meeting, to present its business case. And it first came to the people board as a presentation and to really test out the principles and the support. So that there's partners within the people board from right across the system. So the mental health wellbeing team came to do a presentation both in terms of the activity and achievements of the hub to date, but also in terms of the proposition going forward. And it was a really useful test of the business case with some of our main providers. From that perspective, I'm pleased to say that the business case has subsequently gone to the tactical SLT for West Yorkshire and has been supported. So as a system, we have committed to that long-term establishment of a hub, which was originally funded from short-term COVID money. So that's a really good positive for the system, and certainly colleagues in other ICBs are keen to understand around what we've how we've achieved some of the activity of that hub. A further area of the people board in November was an initiative called Breaking Barriers to Innovation. And this is an organisation, it was a presentation by one of their directors, Nick Warren. And this is an organisation that, again, is working hard with us. I suppose the title is, as it suggests, it's breaking barriers, not just to innovation, but to areas against the people plan, such as recruitment and attraction, and also to development. I'm really pleased to say, in terms of the stage of taking that initiative forward, that Wakefield Place have come forward to say that they would like to be the pilot area for West Yorkshire. So we're now working closely with colleagues at Wakefield Place on that, and certainly for another partnership board meeting we can provide some further update. But that was very much against the strand of belonging to the partnership in terms of that. We've mentioned perhaps already the principles of volunteering, which is another area that's recently been explored by the people board. And a final piece for me to mention is that the strategy that Rob's just mentioned, the 5-year strategy refresh. The people board colleagues received a really good presentation from Bilal Mohammed, and Joe Farn supported him, both in terms of updates from the engagement workshops, but also how the strategy was shaping. So very much as we're hearing today. So they were the headlines from the November group from that perspective. Rob's also asked me just to mention in terms of the strike activity, and you'll all be aware that the RCN, certainly in West Yorkshire, and it's very much as it's detailed in Rob's paper, had identified from their ballot results there were 4 organisations that did vote for industrial action. There's actually 3 that the RCN has selected, that being Leeds Teaching Hospitals, the Leeds Community, and Bradford hospitals also. The first 2 strike days have been mentioned, not mentioned, as the 15th and the 20th of December. And they and all of the planning and activity that you would expect is underway at the moment. Each health organisation in the region, including the ICB, has been asked to do a self-assessment, a preparedness assessment for industrial action. And one of my colleagues on the call, Anthony Keeley, and the team are leading the collation of that. So there's an awful lot of work and planning behind the scenes. And at the moment, of course, the organisations are having conversations with the RCN in terms of derogations, in terms of areas that will continue during those strike days. You'll also be aware that the ballots are starting to come in from other unions, and certainly Unison for our local area. And we have just seen a headline, one of my staff has just sent me through whilst we've been in this meeting, that the first strike day for Unison, Unite and GMB has been named as the 21st of December. I've just received a notification of that in the last sort of half an hour. So certainly locally, we anticipate that Yorkshire Ambulance Service is from a unison perspective that will apply there. So again, we're working closely with colleagues in Yorkshire Ambulance Service. The HR director there is linking in with us all to understand, obviously, some of the impact that will have across the wider system. So from that perspective, that's the latest news that we have. Thank you. I'll hand back to Rob. Thank you.
Thanks, Kate. So in all of this, we've been very clear that we continue to have good relationships with staff side, and we manage together the consequences of the dispute between the unions and the government. We're working very closely to ensure that the issues around safety are minimised in any action that is taken. And we continue to hope for a resolution between the two sides. All of our work around elective recovery and planned care and other services will be affected by the strikes if they go ahead. The very last thing I was going to mention was that we continue to try and ensure that we use the flexibilities that are available to us to make progress locally. We can do that because we have strong leadership and good governance and good relationships. One of the things that you can see in the paper is that the Department for Health and Social Care, which has a base in Leeds, wants to work closely with us, and we've created this Leeds hub, which gives us the opportunity to try out and work together on talent and workforce and skills, some of the digital and tech work and innovation, and on policy. So that continues to make progress in all of those areas, and I'm really pleased with the work and the progress that's being made there and the opportunities that might give us in the future. So apologies, it's probably been slightly longer than we expected, Chair, but I thought it was important, particularly to get an update on Strep A and the industrial action. Thank you.
Thanks very much, Rob. So can I invite any questions or comments on Rob's update, please? Fiona.
Thank you, Chair. It was a comment rather than a question, Rob, and it really comes out of the finance element of your report, but also the risk register is also in that document. And I'm aware from the more informal meeting that Cathy chairs of the Leaders and Health and Wellbeing Boards, that it has been flagged up at a regional level that the really pitiful state of council finances is a risk across the system. And I'm just really wanted to formally flag that here, that we're just massively challenged. We're all setting our budgets at the moment, and the cuts that we've got to make are probably the worst we've had to make in 10 years, or certainly in Leeds, that's the case anyway. And it's a risk to the whole system. Obviously, it's a risk to the services we provide as councils, but Kim's already mentioned the third sector. We commission a lot from the third sector, from councils, from social care. So I just wanted to flag that up, really. I know you all know, but I guess I wanted it to be formally noted that the state that councils are in financially represents a risk for us all going forward. Thank you.
Thank you, Fiona. Susan.
Yeah, I'd just like to endorse what Fiona said there as well. I mean, I thought there was an action to change this risk register actually to reflect local government finance constraints, and I can't see it in there at all. So I'm not sure if that's been missed. But secondly, I just wanted to ask about the refugee element of your report, Rob. And obviously, I don't want to discuss individual cases on a public call, but we're all aware of those cases that have actually been appalling and very badly handled by the Home Office. And I do think, I'm not sure if it's happened already, but I do think it would be good for the system as a whole to write to the Department of Health to make them aware of what challenges the Home Office have put the health system under, during these difficult times, and that must not be repeated, mustn't that behaviour? And I just wondered if that's something we can make a collective, because actually this is people's lives, and I think we have to flag it just to make sure they realise how serious it is, and therefore I think it would be good to put that in writing.
Thanks, Susan. Rob, do you want to respond to those?
Yeah, sure. I mean, I think the council finances is definitely on the board assurance framework, and in terms of the risk register, I think the risk register for the last integrated care board papers is linked on the agenda. It won't have been changed since then for what's in the public domain. In terms of the points around refugees and asylum seekers, all of the issues that were picked up immediately and subsequently have continuously been fed back through the system to the appropriate people. And Robin Tuddenham, as the lead chief executive, has been engaged with the Home Office directly, and Bev, through the nursing directorate, has been working all the way to national teams around issues here. I think, Councillor Hinchcliffe, there's a very straightforward way of approaching this, which is the way that we're doing it, which is to say that in the health and care system, we have an incident reporting set of arrangements, and we have a way of grading harm to individuals, which people will be familiar with. What we must do in these circumstances is to assess the degree of harm, whether it's no harm, low harm, moderate, severe harm to individuals, and then we have an investigation, and that investigation creates a report, and that report is shared with people who need to learn lessons. So that's the intention, and that's what we've set up. So through James and Bev as the leaders for quality, that's what we'll do for issues that arose in Bradford and issues that arose in Wakefield. So as you say, we don't want to talk about individuals, but I think we stick to the processes that we have, and we make sure that that allows us to have the information and the evidence in a very objective way, and that we ensure that partners who need to learn lessons are aware of what the lessons are. I hope that's helpful.
Thanks, Rob. I've got Kathy and Robin on those points. Kathy?
I think Kathy's frozen.
Okay, I'll go to Robin and then come back to Kathy then. Robin?
Thank you, Chair. Yeah, I just wanted to just respond to Councillor Hinchcliffe's comment about the asylum seeker work. Just to provide some assurance that we have raised this at a national level, and I haven't chanced to feed this back in any detail yet, but I was asked to meet with Jenny Harris from UKHSA on Friday afternoon to go through some of the issues that are happening across the country, actually not just in West Yorkshire, but although we are particularly affected. So, and got some positive assurances from her and her colleague about the fact that there was a level of focus on this issue, and there is work now being done with the new Perm Secretary at the Home Office to ensure a basic level of assessment of risk, and some work prior to dispersal into the community. I hope that's the case, but certainly it was positive that we had the meeting. Thank you.
Thanks, Rob. Kathy, are you unfrozen? No. Okay. Okay. Any other comments for our questions on Rob's report? So if we can note that and the various actions that have been identified as we talked about that, and move on to item 46, the Tackling Health Inequalities report, and I'll hand over to Fatima and colleagues.
Thank you, Chair. Apologies, I didn't introduce myself previously. I was so eager to answer the action. My name is Fatima Khan Shah. I'm one of the Associate Directors here in West Yorkshire's Health and Care Partnership, and I hold the overall responsibility for the delivery of the independent review into inequalities impacting our communities and staff. Before we begin, can I just introduce the presenters, please? I think we've got Ganeez Khan on the call. Ganeez, do you want to introduce yourself, please?
Hi, yes, I'm Kenise Khan. I'm the chair of the VCS Voices for Race Equality across West Yorkshire Health and Care Partnership.
Thank you. And Em, would you like to introduce yourself?
Good afternoon, everyone. I'm Emma Irving. I am the Senior Manager for Improving Population Health.
Thank you. So I'm now going to attempt by the medium of magic to share my slides. Just bear with me a second. Em, I can see you in the corner of my screen. Can you just confirm that they're in slideshow for me?
It does look like it to me.
Good. And are they moving?
They are indeed.
Excellent. So just to remind Partnership Board members, this is a quarterly update on the independent review in which we do a focus on two themes of the overall report. This month, we're doing two specific areas, which is population planning and reducing inequalities in mental health outcomes by ethnicity. So we'll kick off with Em's review and then I'll cover Kia's. Over to you, Em.
Thanks, Fatima. So I think our board members will have received the papers, which gives a bit more detail. So I'm just going to highlight some of the major successes, I guess, since we last presented. So the West Yorkshire Health Inclusion Unit is now under development. We've got a job description at grading, and that's going to be looking at how we can support prevention and treatment of ill health for inclusion health groups across West Yorkshire with our partners. So it's very much in the scoping stage. The project manager will be looking at how we pull that together and what it looks like, and then how we can support the health of those inclusion groups. And it probably primarily will start with our migrant, refugee, gypsy and traveller communities, as they were our priority groups identified earlier this year. Partnership of Sanctuary. So we took our application for Sanctuary to present at the accreditation panel on the 30th of November. This was an full application and action plan that's been developed with partners across the system, and we previously presented this at Partnership Board in the summer, I think last year or this year, and it's in relation to the experiences of health and healthcare services for migrants and refugees that are in vulnerable circumstances. So the aim of the work is to identify how the Health and Care Partnership of Sanctuary can provide strategic leadership and commissioning, increase capability, capacity and intelligence to meet the needs of our migrant population across West Yorkshire. And I'm pleased to inform the Chair and the Board that we've successfully received Sanctuary status. We will become the first partnership of Sanctuary, and we'll be finalising the details and launching this in January 23. So the next bit of work we've been doing across the system, Freddie Garber and other presenters I think are going to provide further detail on this later in the meeting, is around poverty and inequalities, and tackling poverty and mitigating harm where we can. So the main focus is around reducing cost to households and providing support to employees, supporting voluntary community sector organisations, ensuring mental health and suicide prevention services are provided and providing appropriate support, and ensuring that services are proactively responding to the impact of the cost of living crisis. And there's further work, and it links to the work that we're doing in adversity, trauma and resilience, where we're continuing to work towards our ambition of being a trauma-informed and responsive system by 2030. We've had a focus recently on the impact of poverty, which has many impacts in relation to trauma and adversity, particularly around the fear of poverty, and is very much related to historical and societal trauma. And that's particularly for our Black, Asian and ethnic minority groups and populations. So our next steps are to look at this in more detail and to launch 2 additional work streams of the Adversity, Trauma and Resilience programme, which will be health inclusion and the trauma of racism. So I'm just going to end on another success story, which is the Improving Population Health Fellowship, aka Health Equity Fellowship, which has just completed the first year. All the fellows have completed the programme, and we're going to be celebrating their success and they're going to be presenting case studies of their projects at a celebration event next week. But just to say that a number of our fellows have gone on to have other successes as a result of undertaking the programme, and particularly Emma Pears, who has not only had her work published, and her work was looking at mental health of children and young people in rural areas. And this was particularly in relation to the fact that community and voluntary sector need to perhaps do more and be able to do more to support NHS services. And she's had that work published, but she's also secured £80,000 on the back of the research and the project that she's done to implement the recommendations. So that's fantastic for Emma. And we're on with year 2 of the recruitment. We've just extended it for another week because some people have just asked for an extension. So we thought we'd oblige. And we're expanding the programme. So this year, as you can see behind me, it's a population health fellowship, and we're looking for 30 health equity fellows, 30 adverse trauma and resilience fellows, 5 suicide prevention and 5 climate change fellows. And that isn't because we don't value suicide prevention and climate change, it's about support and mentors available as to why those numbers are slightly smaller. And that's it for the population planning theme.
Some wonderful positive stories there. So I'm just going to move us on to theme 4, which is the reducing inequalities in mental health outcomes by ethnicity. And I'm going to be covering this for Kia, who sadly has been called away to an emergency. So the first thing I think is really important to acknowledge how embedded this is within the programme governance and in the sort of infrastructure of the Mental Health, LD and Autism Collaborative. And that is a testament to the leadership of not only Kia, but Sarah Munro, the SRO, and other colleagues within that collaborative. What they've been doing on a regular basis is receiving assurance on how each work stream is taken through specific actions to reduce inequalities, and in particular wanted to highlight the work they've been doing on suicide prevention and the bereavement service, really recognising some of the nuanced needs of the South Asian community when it comes to bereavement and some activity in that particular area. There's also been the fantastic appointment of a consultant in public health supporting the collaborative, and this is in direct correlation to some of the feedback we've had previously within the partnership board about the importance of data, about focusing on this agenda with a public health lens and a population health lens, and ensuring that the work that we're doing on this agenda can really demonstrate that we're moving the barometer on the outcomes of this within specific communities. The Community Mental Health Transformation Collaborative has also been working really hard on a framework for places to consider the impact of inequalities in their provision, really embedding it within the grassroots of our communities, again, building back on some of the feedback from our colleagues, saying the impact that sometimes feels really positive within the system isn't always reaching the grassroots of our communities, and hopefully our work with PCNs will address that. I think the other element which is important and is mentioned within the paper is that although this is focused on elements of race inequality, it also recognises the intersectionality of other protected characteristics, because we're not all one-faceted, are we? And hopefully we will see some positive outcomes in those areas. I think the other thing to really recognise, and it isn't on the slide, but it's also to assure the board, is the movement on the independent disciplinaries, which was an action from the review. And the Mental Health Collaborative have been working really hard with colleagues in HR about work on the employment policies, but also disciplinary panels, really starting to move the dial on that particular action from the reviews. The other element, I think, which is really important, and it goes back to what Kate was discussing and Rob's report about supporting the well-being of our staff, and importantly, recognising cultural competence and racial nuances for different elements of our workforce, and really making sure that the hub that we currently have is meeting the needs of everyone in the workforce of West Yorkshire, and really recognising the diversity, which is an asset to our workforce. And then the final area was just really recognising some fantastic work that the team have been doing on cultural competence and humility training, and this has been in collaboration with Touchstone and other VCSE organisations. They completed the framework in August 22 and hopefully will be operational very soon. So as you can see, the grass has not been growing in the collaborative, and they've been moving at pace in a number of areas. I'm going to pause there just to bring in Kenise, who's going to talk us through some of the feedback from the voluntary community sector, social enterprise, voices panel. This panel, just for the benefit of partnership members, is an independent panel which is chaired fantastically by Kenise and is there to give us that continuous constructive feedback about our progress on the agendas, but also to highlight areas where actually there's an opportunity here that we might be missing. Over to you, Kenise.
Thank you, Fatima, and thank you to and Kia for all the work and the teams that are doing all the work across the partnership. But we've had some questions for a while, and it's around data and who are the people. So we meet once a quarter. It's for 1.5 hours, and there's such a huge agenda in all the 4 themes that we're working across, and there's only so much we can focus on. So we've got to think about capacity. We come from the lens that we know every single person sitting around this table is committed to the communities that they're serving, they care, and they want the best from us. And that's the lens that we come from. So we know that in some areas of the region that black men are most disproportionately affected when it comes to sectioning, Asian women when it comes to perinatal care. And we know that there has been some funding that has been applied for by I'm quite specific, by Leeds and York Partnership Trust on a research project for asylum seeker women where it comes to perinatal care. The thing is, we don't have enough information about what's going on in each area. And because I'm going to declare a conflict of interest, because I am an ed at Leeds and York, I was able to get some information around statistics, because I ask at board all the time, who is it? Exactly the same questions I ask here, I ask there as well. Who is it that's most disproportionately affected, and what are we doing about it? So in a minute, I'm going to ask for Sarah Monroe to come in on some of the feedback around that, but also if they could come back in 6 months and present on work and progress as an example. But this is just because we know about Leeds and York right now. We're asking everyone to share good examples of work that they're doing when they collate the data at each area. So Wakefield, Bradford, whichever areas that we're covering, you're going to have data. We don't have that data. We don't have the collation of that data at West Yorkshire and Health and Care. So our request is for that data to be collated within Care's department around who it is that's most disproportionately affected. And then again, at Partnership Board, maybe for 5 minutes in this section, if somebody can volunteer, one of the organisations can volunteer and say, this is what we've been doing. So I think at this point, I'll bring you in, Sarah, before we get on to the population planning.
Thanks, Kenise. And I do welcome the idea of bringing just in bite-sized chunks, sharing some of the good practice, because we know certainly through the programme board, every area's got different examples of good practice because it's about responding to local population need, and that's the way it should be. And Tim's on the call as well. We've got the work that we're doing across all of partners in Leeds called the Synergy Collaborative, which is absolutely targeting both in children and young people, but in men, Black African men, reducing the improving the support for early access to mental health so that they don't end up finding yourselves at the more secure end of the pathway. And just some of those other examples you referenced there in terms of perinatal, doing some of the outreach work with South Asian communities, led us through the wider West Yorkshire programme to commission some research from Born in Bradford to understand what that wider population need was to help with that longer term planning. So it's where we take those local pockets of good practice and then through things like the programme board says, so how can we systematise that for all of our populations across West Yorkshire, and of course affording the ability to nuance. And we're doing that very differently now for the maternal mental health offer. We're building it up of starting with look at where the variation is first, and rather than design a service and retrofit afterwards. So experimenting with different ways. So thank you.
Thank you, Sarah. For that. So if we can try to get the data initially, we do need data collated at West Yorkshire Health and Care, but also I think Sarah's going to come back maybe 6 months time, and then if we can have a rolling programme of different areas that are doing excellent work. I know I've heard some work in Bradford, Wakefield, we do need to know and share positive examples. So when we come into population planning, I can't, really great work that Emma and the teams have been doing across the board. But again, we're coming back to what it is that is important to the VCS partners here, and that is around reaching those communities that we haven't previously been reaching, but also recognising that during COVID at each area we worked so brilliantly at bringing reaching those communities that we've never reached before, and that learning, I can see that is coming forward into working that way as the normal now. But I had spoken to Tim around what they're doing in Leeds. I'm sorry that it's Leeds focused today, but please come back again. We're asking for examples to be brought every 6 months, small bite-sized examples of what's happening across the board every 6 months on what it is Leeds is doing around looking at how the commissioning process, so that we're not having a knee-jerk reaction when the turnaround has to be so fast when funding comes in, and how we're reaching the smaller groups. Tim, can I quickly bring you in, please?
Yeah, thanks, Kenise. I'm not entirely sure what you were expecting me to say, but thank you for the opportunity. I think there are only three things just to mention quickly. One is we've, like many places, we've made the Synergy Pledge, and that's a group, a third sector and statutory sector, who are there primarily to influence and to create communities of practice around this whole agenda, and that's a group that I'm on, and it goes right into the sort of heart of governance and leadership across the cities, and is really influential. So when we set outcomes work in the way that we look at our boards and so on across the city, their influence is fed into that, and we have actually got some goals that we've set locally around, for example, reducing the number of black men is one example who find themselves in the more serious end of mental health services. So that's one thing. I think the second thing probably to mention around this is providing data to local communities with the right depth to it. Now, we did some of that during pre-COVID. We did some of it very clearly during the COVID piece, but we're building on that, I suppose. And to me, it has to be really data-led and data-driven. And therefore, you can start to target support and involve communities in what really needs to be done at the most local level. And then the third thing, just to briefly mention, is when we had the health inequalities funding, what was really important was some of the groups and some of the work that Synergy, for example, had done really helped us direct to some of that. So we were able to put some of that funding into groups, again, particularly supported black men with mental health issues that were very community-based, very community-led. I hope that's sort of what you were expecting, Kenise.
Thank you, just to say that my message to you went through Sarah, so I didn't have the quite time to have the conversation with you. But yes, exactly that. And that's it from me, I think, for today.
Thanks, Kenise. So just to wrap up regarding the recommendations, I think what we've tried to demonstrate today, and it is the second birthday of the action plan of the review, so we're 2 years on now, is that we are still managing to move at pace and deliver some of these complex actions. But what we're now trying to demonstrate through some of Kenise's feedback is the synergy with our local places and the ability to deliver some nuanced approaches, really recognising the different populations of West Yorkshire and the impact that that can have. But having said that, there are still some recommendations and areas of improvement. The first is very much recognising the limitations of the data and the importance of some of the data that is needed, particularly through a population health lens, to really inform some of our decision making, particularly as we're moving into more finite resources, to ensure that we don't perpetuate or continue to perpetuate that inequality that we've seen so far during the review. The second is a real important message from the VCSE sector about how stretched it is, the risk it has, but in particular those small organisations that are doing amazing work with those grassroots populations are significantly at risk because of some of the structural inequalities that we currently have, about an expectation for putting in bids, about the timeliness and turnaround, etc. So there are some important key messages as well as positive things to celebrate when it comes to the review. And I hope that the board appreciate and sort of accept our update while recognising some of the areas of improvement. I'll hand back to you now, Chair, if I may. Thank you.
Thank you very much, Fatima and colleagues. I've got Kim and Karen both wanting to comment. I'll bring those in quickly and then come back to you if there's anything to pick up on. Kim?
You're on mute, Kim.
Sorry. Fail. Thanks, Chair. Thanks to the presenters for the update. I think there's some fantastic progress made. I wanted to just create the link back between the VCSE voices to the point I made about VCSE sustainability, because rarely a few days go by when I don't get a desperate phone call from usually a manager or a chief exec of a small grassroots organisation that is, and predominantly those organisations are those working with minoritized communities. So and I think what I wanted to make a point about was the danger of unintended consequences that might happen in the next few months if we're not very, very careful about looking at how decisions might widen health inequality. So I know that there's the people around this table will recognise those things very strongly, but sometimes the way that those decisions are made are at the operational level around commissioning and contracting. And when people are under a great deal of pressure, often we just don't have that time to have a look and think about who are those organisations and people who are most likely to bear the brunt of those cuts. And that is happening, and it's happening every day. So we have put forward some recommendations that we really encourage people to look at straight away. And of course, that doesn't take away from our longer term ask and, pledge to try and create a more sustainable position. But I just wanted to really echo now the level of absolute desperation, but also the very, very high level of risk of widening health inequalities if we don't look with a fine-tooth comb at the organisations that are receiving the funding or being cut in the next, in the coming period.
Thanks, Kim. Karen?
Thank you. As a social enterprise in the room, I really, really support this work. It's critical to support, and if we lose some of this, the outcome will be more pressure in our systems. I think it's really important to recognise as well, we need to continue on a wider stage for this. So with Social Enterprise UK, I'm involved in advocating at the national level about why these kind of organisations are so critical to partnerships and what they achieve together. And it's not simply the statutory bodies. So this work is critical both at the very local level and to support that, and throughout our systems and our advocacy role. So I'd like to encourage that as well, please. Thank you.
Thank you, Karen. Kenise?
Just to give you one example of one of our small groups, I think just to highlight how important it is that we get it right for the tiny ones. And on my day job, I work for an organisation called Near Neighbours, and Wales brings together two organisations basically, but we're a small grants funder. And this organisation literally saved women's lives during COVID, ethnic minority women who were really vulnerable to domestic violence and so many other mental health issues and so many different complex issues. But between January and July, we didn't have our funding and government didn't give us it again. Between January, they had no funding whatsoever, none. They did everything voluntary, and they have like 60 women and children and their families that are on their books, and they had no support, and they managed to get some funding back in July again, and we've supported them again. So hence I hear, just like him, I hear so the desperation from the group. So when repeatedly bang on about supporting the smaller groups, it's because they're the ones that are most at risk, but they're the ones that are going to be able to narrow the gap in health inequalities. They are actually the groups that are going to be able to do what needs to be done to help our CQCs, to help all of the health inequalities and the outcomes. I can't stress how important it is.
Thank you. And Majid.
Good afternoon, everybody. I'm Majid. I'm one of the non-execs on the ICB. Just wanted to follow on from what's being discussed about the voluntary sector. Through COVID, we saw time and time again how the voluntary sector really come to the fore and supported the overall effort on health and social care. And I just wanted to check in terms of measurements and data, etc. As a system, do we know what the spend is with the voluntary sector and how that's broken up by place and by group, etc. And secondly, in terms of process of commissioning, etc., what sort of provisos do we have on larger suppliers to make sure that the voluntary sector and those smaller community groups that's been alluded to a few times are engaged in that supply chain process? I think it's important to keep a measure on it to see, in terms of our spend, how much is actually going into the voluntary sector and tackling those broader inequality issues and contributing to reducing deprivation and poverty, etc.
Thank you, Majid. I don't want to cut discussion too short, but I'm aware of time moving on. Kim, do you want to come back briefly on that? I know there is data and some previous work that's been done as well. You're on mute again, Kim. Sorry.
I'm not usually this terrible. I blame Christmas. I'm happy to put something in the chat, Chair, if it's helpful to provide an update on that if we're short on time.
Thanks. Yeah, that would be really, really useful. I'm aware some of that's been covered in some of the work that's been done before. But yeah, that if you share that will be useful. So can I thank you everybody for your contributions on that item, and just confirm formally we're happy to endorse the recommendations that Fatima highlighted earlier. Thank you very much, everybody, and thank you again for presenters on that item. So item 47, the Adult Social Care Discharge Fund, West Yorkshire approach to this. So can I ask Richard and Karen? I'm not sure who's leading off on this one, please.
I think Richard is, but I think he's had to drop off to another call. Can I just text him? Is that okay, everybody?
Yes. Of course.
Just need to get him back in, sorry.
In the meantime, I don't know if Jonathan Webb wants to say any introductory remarks about the funding.
Can do. Thank you, Rob. So this has been trailed for quite a while now. So it's a £500 million fund for adult social care discharge that's been made available. We received a notification probably about 2 weeks ago now of the resource that would flow through directly to local authority, as well as the resource that would flow through the ICBs. We've taken, I think, a fairly pragmatic approach in terms of how that money will be distributed to the 5 places in West Yorkshire. The resource that's gone into local authorities has been determined nationally, so that's based on the national formula. There was some a formula used by NHS England to distribute the ICB's allocation to each of the specific ICBs. What we've done, or what we've proposed in West Yorkshire, though, is to distribute that resources based on a weighted population basis, which is deemed to sort of fairly distribute that resource to our 5 places. We collectively worked through some principles about how that resource would be deployed. And that was very much about supporting the Home First principle to continue some of the discharge to assess processes we've put in place recently. I think importantly as well, I think we also recognise in West Yorkshire that both local authorities and the NHS has gone at risk in terms of committing resources to support patient flow and the pathways required to support the patients into domiciliary and into care home sectors. So the paper sort of sets out the rationale behind that. I think that's probably the crux of the paper, Chair. I don't know if Richard's now joined or not.
Yeah, Richard's now here.
So, Richard, you may have caught some of that. You may want to add some further comments.
Thanks. I guess the observations I'd make is, it's not an unhelpful sum of money. It probably comes quite late. And I think we've reflected on as a kind of West Yorkshire partnership is the importance actually of how we make a sustainable shift in the way that across the whole system we act and operate to support discharge and getting that right balance between the really important services that are provided within a hospital setting, but equally the services that we need to have in place in a community to get people out of hospital in a very timely way, back home and living as an independent life as possible. So there's something about this is, let's say not unhelpful. There's something about us continuing with our long-term plans as well and seeing this money in that context.
Thanks, Richard. I think that's the important part that we want to see this applied in the context of our long-term plans and not simply used as the government have delivered it, largely as a sticking plaster to hold the system together. I think I'd probably argue back to Jonathan that, yes, in some senses the decision is pragmatic, but actually I think also, the decision to largely passport this through to local places to follow local priorities is also one of principle that's very consistent with our values and approach as a as an ICS, and it will be interesting to see how other areas who I suspect will try to manage this more centrally get along, and that might be something we want to look at going forward. Are there any questions or comments on this, colleagues? I'm not seeing anybody at the moment, so can I take it that we're happy then to endorse the recommendations and the arrangements for sign-off? Rob, do you want to come in?
I was just going to reflect that point about sign-off and the role of Health and Wellbeing Board chairs. And one of the really positive things about this group is that we have Health and Wellbeing Boards represented. So, like you, Tim, I think the principle is right. I think locally decisions can be made between partners around the use of the resources in line with the guidance and funding that's already been committed in advance of the final detail being made available. But yeah, I just wanted to make sure people were clocked the Health and Wellbeing Board role in sign-off.
Thanks, Rob. Yeah, that's an important point. Viv.
Thank you, Chair. I'm concerned very much about the volume of discharges that have gone up. It's gone up in Kirklees 36% since 2019. And actually, I think the money could be used more effectively, if you like, if we had more timely warning about discharges and recognition that the challenge on the care sector is just phenomenal, trying to deal with it. And nothing in the paper talks about the patient experience of discharge. You know, people sometimes will be waiting to discharge 5 hours waiting for their medication before they can go. Discharges happening at all sorts of times of day and night. If you know Mrs. Brown is likely to be going out of hospital, surely there should be some earlier planning. And I just worry that the care sector is really going to struggle to deal with this effectively.
Thank you, Viv. Robin?
Thank you, Chair. Yeah, just to connect to the last comment, I suppose there's a bit of is it a Christmas wish or a New Year's resolution? I think I have no issue with this paper, but wouldn't it be wonderful if we could start a different conversation about social care being about people flourishing and living larger, bigger lives of hope and possibility, and not just about places to put people when they need to come out of hospital? I suppose it's a bit of a sort of plea for that, really. That's sort of a wider comment, really, about the conversation that maybe we need to set, because I don't think that solution is something we can wait for from a central location in government. And I just sort of think that there's a possibility here when we are through this next sort of period as we emerge into the new year and the sort of next year. And I know there's some work around the strategy around this, but see the potential to see social care about the vast majority of people, most of whom receive social care services who aren't anywhere near a hospital, and how we give them bigger lives and fulfilling lives. And in Calderdale, we've got the age-friendly borough, and living a full life in later years is, and with the possibility to flourish in that phase of your life, is something I just think we could aim to try and think about more. Thank you.
Thanks, Robin, and unsurprisingly, I agree. And I think, I do fear that if you look at the Secretary of State's priorities as set out in noted in Rob's report, we kind of seem to be moving backwards a little on that kind of general understanding of the wider framework and that focus just on a very narrow part of the role. Karen.
Thank you. I agree absolutely with Viv and Robin there, and so I, with Richard and Penny, lead on discharge in the ICS, and what we've purposely done is we could see ourselves getting completely immersed in the winter situation. So what we've purposely done is focus some of our time on the longer term. How do we support people to flourish? How do we make sure this is not just a Christmas solution? So we're very focused on doing that, and we'll continue to take that through that piece of work so that we can measure outflow beyond the walls of the hospital to support people in the places that they live. I think it's important to say as well that the Fuller Board will be critical in in that more medium-term piece of work that we're on with. So just wanted you to know that we've split our work purposely so we can carry on doing that and just not get immersed in the immediacy. So Viv, thank you. That's really helpful.
Thank you, Karen. Kathy?
Thank you, Tim. There are very specific metrics in that document and that letter from Department of Health. We need to deliver them. But also there's the word flexible in there as well. And Rob, I'm going to steal some of your words, that as long as it's legal and it's within the guidance that we're receiving, we need to do what's right for our communities and our population. And that's the innovation and creativity that we achieve well together. So, and I've sat in some of your place to committee development sessions where I've heard very open and honest conversations between health and care leaders in saying, actually, we're going to do it this way this winter, and then next winter with more time and planning ahead of us, we're going to do it differently. So Robin, I support your point, and I think there is something about common sense and meeting the needs of our communities. So this is an example of how we're navigating having devolved ways of working as well as still delivering for government and NHS England with metrics. So, but I hope colleagues within places and next place committee meetings can explore ways in which delivering now as well as for next winter, as Karen, you just talked about.
Thank you very much, Kathy. Thank you, colleagues, for those comments and also the endorsing comments in the chat, Richard. So if we're happy to sign that one off then, and okay, thank you. Then item 48, patient and public voice. Could I ask Mark to briefly introduce this, please, Mark?
Certainly. Thanks, Councillor Swift. Yeah, just very briefly, I'm Mark Brooks, Chief Executive at Swift. The video I'm about to show actually very largely speaks for itself. It's about our creative approaches that we're taking in mental health, particularly across the Swift footprint of Calderdale, Cairclees and Wakefield. I think it's really helpful in the fact that it really demonstrates how we use creative approaches to meet individual needs, recognising that everybody is an individual and that there isn't always one intervention that suits everybody. So we obviously have our own linked charity within Swift Creative Minds, and also have a mental health museum and a Spirit in Mind linked charity as well. So I think with no further ado, we'll just show the video if you can do that, please, Laura.
Creativity has really kept me above water.
Creative approaches is really important because it focuses on your wellness rather than your illness.
Creativity is actually sort of bringing services together.
The feedback that I've got from students, I'm like, yeah, I'm getting confident now.
There's just nothing quite like it out there, and to be part of that is absolutely amazing.
Here at South West Yorkshire Partnership NHS Foundation Trust, we are absolutely committed to ensuring that we continue to develop and deliver creative and cultural opportunities and solutions for everyone that uses our services.
Creative approaches are very important to us. We recognise that traditional therapies might not suit everybody, or we are all individual, and creative approaches can mean many different things to many different people.
The Trust offers quite a few creative approaches. So we've got Creative Minds, we've got the Recovery College, Spirit in Mind, Pastoral Care and Volunteer Services. When we talk about creativity, it can be anything. Mine was an art class, but it could be cricket, football, rock climbing, singing, dancing.
I have several mental health issues. I suffer from obsessive compulsive disorder, so that really just takes over my mind and my life. I've started with Creative Minds. I'll just paint on anything that I get my hands on, and as long as I'm producing something that is better than what my mind's thinking, it makes me happier.
I lost my mother about 2005. I went off rails a bit, suffering right bad anxiety and depression. I started counselling in 2007 via pastoral spiritual care. Now I'm involved with Spirit in Mind in an ambassador role. Since working with Spirit in Mind, I picked up new skills, new tips on how to deal not only with my mental health, but other people that's coming into chapel.
The Mental Health Museum starts and opens up discussions around mental health. The museum is about the history of Wakefield Lunatic Pauper Asylum. It houses a world-renowned collection of artefacts. We try to engage with the service users here. And the idea of that is actually sort of bringing them in and sharing some of the objects. Creativity actually brings a lot of people together. Conversation can take place between the consultants and the service users, and they have an open, honest discussions.
Peer support workers, to me, it's people that have lived experience of mental health problems. I co-facilitate 3 peer support groups a week. They are for mums and their babies, and we offer them holistic
Has everyone else lost the sound?
Yeah, about 30
Yeah,
seconds.
Rob, I think Lauren might have accidentally muted herself.
Right.
Are you there, Lauren?
I'm so sorry. Did you miss all of that, Ian?
No, we've only missed the last maybe 20 seconds or something.
No problem. I'll just jump it back then.
Yeah, that looks about right.
support plays a large part of that.
I had a breakdown in 2019, no medication or therapists were working, and I got introduced to Recovery College at Barnsley. I spent 18 months volunteering, helping people, and then in 2022 I become employed as a peer support worker. I do a netball session, which is my favourite. Difference for me is there were people there who had been through the same situation as me. It was easier to talk to them than it was to talk to other people who had not been through that situation.
I've got bipolar and I get severe mood swings. I've got Wakefield Recovery College and that kind of keeps me focused. I sometimes hear voices and I've written a poem about the voices, and all that kind of stuff really helps me.
The vision for the Trust is to join services up, but it's also to look at prevention, get people before they get really ill. Let's look at creativity right from the start of a person's journey.
Nationally, creative health is seen as a priority now, I think, with the National Centre for Creative Health. And Creative Minds and Swift should take a great deal of credit for that. They've demonstrated that these approaches make a real difference.
Overall, it's had so much positive effect on my life. It makes me feel so happy. When I create something good, I love it. I love it. I've got something else to love.
Thank you. There's some really positive comments, interesting responses to that in the chat as well. Rob, you want to add?
Yeah, I think it's just a couple of strategic opportunities, I think, that we should take. Before I can say that, just thanks, Mark, for sharing that, and thanks to everyone who's been involved in the film, particularly the people affected who've become part of the system and part of the team, really. Creative Minds has been going for over 10 years, and one of the non-execs now of the board played a role in its creation, Becky Mulvey. And that it's been going through thick and thin in terms of funding and everything else, which demonstrates its value, I think. What board members may not be aware of is the two opportunities we've got are linked to the national interest in creativity and health. So that's the first one. So the Arts Council England has its new strategy, which is really focused on the importance of the arts to health and well-being and participation. So it's not the usual suspects who are involved. I think we've got funding for the National Centre for Creative Health to have a hub in West Yorkshire, and we have a team who's working to look at how we connect the creative sector to our health and well-being services. And you can see through things like Creative Minds, you can have an infrastructure that does that makes a real and meaningful difference to individuals every day. Now, I know that the recovery colleges, Bradford District Care Trust and in Leeds and York, that Leeds has got a long history with the Love Arts Festival of taking similar approaches. We still keep missing each other, though, I think, and this being a systematic approach to improving people's well-being. And we need to take the opportunity that there is through the National Centre and its work to do that. Since Salma and David have been involved in the National Centre, we've brought over £1 million of investment into the work, and we've also got some research funding to look at the impact of Leeds 2023, Culturedale, the Wakefield Year of Culture, the Kirklees Year of Music, and Bradford 2025, with hopefully several £1 million of research funding to follow the initial slug of money. So there's a big opportunity around this, which we need to grasp. I think the second thing is, I was with Councillor Hinchcliffe and others last night at a cultural exchange that the Mayor hosted, which looked at the £2 billion industry that the culture sector has in West Yorkshire. And again, there's an opportunity to connect that and the positive energy behind the industry to health and well-being, but it's got to be part of the conversation. And at the moment, we didn't quite grasp that opportunity last night, and we could have done. So I think it's great that this has come today, and I'd like it to be something which we see as part of our mainstream business in the future.
Thanks very much, Rob. Certainly, and again, some useful debate and comment in there, and hope people feel free to share the video more widely as well. Okay, I'm not seeing any more comments on that. Could I suggest at this point that we take a brief comfort break before we have, I hope people are able to stay for the rest of the meeting, because we have two big items after the break, which is the 5-year strategy and the response to the cost of living crisis. So if we restart promptly at 3:55, that should just about give people time to make a cup of tea or get a cooler drink. Thanks very much, and we'll turn the microphones and cameras off during the break. Thank you. So good afternoon and welcome back, everybody, to the remainder of the partnership meeting. The next item is the refresh of the partnership's 5-year strategy, which builds on the work that's previously done on the strategic and forward planning and the 10 priorities that we set out in the plan we adopted in March 2022, but obviously also responds to the changing pressures that have emerged since COVID, the cost of living crisis, and so on. And what we have today is a working draft, and I'd like to ask Ian Holmes and Esther Ashman to introduce this, but also to take this opportunity to thank them both for the work they've done on the plan to date. So over to you.
Yeah, thanks very much, Councillor Swift. Hi, everyone. Ian Holmes, Director of Strategy and Partnerships for the ICB. I think we're also joined by Bilal Mohammed, Esther, is that right? Who's one of the Race Equality Fellows who's been working really closely with Esther on this and has played a really important role as well. So it's great that he's able to join the conversation too. I'll just make a few comments, I think, before I hand over to Esther, who's been doing the bulk of the work. So you remember that we've spoken about the strategy in the March and the September Partnership Board, and we had a really good conversation in the September Partnership Board that was built on the Health Watch engagement insight that Gary presented. We're really keen to share with you a first draft. As you say, Councillor Swift, it's a work in progress, and it's a draft for consideration. There's an expectation that ICPs produce a draft strategy by the end of the calendar year. So we're using this opportunity to do that, but we're expecting to further iterate it through the early months of next year so that we can bring a final version for sign-off at the March Partnership Board. We've heard a lot over the last 6 to 9 months when we've been working with partners on this about the importance of constancy of purpose. So what we deliberately try to do in the strategy is remind ourselves of why we're here, our way of working, the principles of subsidiarity, re-emphasise the importance of the 10 big ambitions, and it requires really good system working to deliver those ambitions. So a lot of what's in this document will feel familiar, and it's deliberately familiar But as you said at the top, the context has changed around the pandemic, dealing with the pandemic and the consequences of the pandemic, cost of living crisis, the workforce challenges, which are now more significant than they ever have been. So we've tried to reflect that context as well. We've been out and about. Esther particularly has been out and about. We've engaged with all health and wellbeing boards a number of times, lots of place-based partnership arrangements, scrutiny committee, and that's all gone into the development of this draft. We'll continue to do that engagement after Christmas. So we'll be back out to scrutiny health and wellbeing boards, particularly in the new year, so that we can get further comments and input. And what we've been trying to do is build really strong connections between the West Yorkshire strategy and the 5-place health and wellbeing strategies, so that we can absolutely understand that synergy and recognise that the delivery of the strategy will be through those 5-place arrangements. I guess the final thing I'd say is that we've published this draft at a time when there's still a degree of uncertainty around the next couple of years. As Rob said, we're waiting for the planning guidance, which and the specific asks relating to that, which will come out hopefully around Christmas time. There's still talk of a long-term plan refresh, which will influence our joint forward plan, and we need to understand the specific contents of that to influence our strategy. So, and clearly over a 5-year period, there's some uncertainty around the level of funding that we'll receive. So we're dealing with that uncertainty, but as we get more clarity around those things, we'll use those to, shape and update what's in the strategy too. So Esther, can I hand over to you, please? You want to provide a little bit more context on the work you've been doing through the design group?
I will do. Thanks, Ian. So hello, everyone. My name's Esther Ashman. I'm the Associate Director for Strategy for the Integrated Care Board. I've been leading this work for the last, I think 10 months now. It's been alongside my colleagues Shane Hayward-Giles, Bilal Mohammed, who I think he's going to join shortly, and Myron Rogers. But just as a reminder that this work hasn't been just us, it's been driven by a strategy design group, which has represented the whole breadth of our partnership. We've had, as we've collected people, as we've engaged along the way, we've got about up to 60 people now having some kind of role in the group, and I've got to first and foremost thank them all for their dedicated time and their work to get us to the draft strategy you've seen today, because I don't think we would have got to a point where we have something that represents the entirety of our system and a really truly integrated strategy without their time, input and commitment. I think they've really shown the values and behaviours of the partnership in particular. I've been really inspired by their input, which has been fantastic to see. So you'll see 3 documents for deliberation today. You've got a cover note which just describes some of that process, but also some highlights of where we are at the moment for the 10 big ambitions. So you had a report back in, I think it was September last year, which provided an update against the metrics for each of the 10 big ambitions. This is another update from that. As you'll see, I think the message we had from the board back in March was those are still relevant, and I think you'll see from the data that they are still very relevant for us, and there's still a lot of work to be done around those 10 big ambitions, and then the working draft of the strategy itself. So just to remind the board, as I said, we set out in papers in March and September that this has just really been about 20% about refreshing the words of the strategy, as Ian's just described. We had a clear message from you, a light touch refresh with the 10 big ambitions still being our priorities. There's been lots of additional feedback that we've wanted to weave into those priorities, very much specifically around cost of living increase, access, some of the children's work as well. So all things that are really relevant on the agenda today. And then it's also been supported by that data update against the 10 big ambitions as well. And then also on top of that, the people insight as well that we've been able to gather along the way. The other 80% of the work has actually been about developing new ways of working in our partnership. So trying to make sure that how we work going forward will actually deliver the strategy. So we have a system that we want it to be in the future. That's really been very much at the centre of the design group. We've been giving them lots of different tools as to how to work. As you can imagine, Myron Rogers has been doing some great work supporting us with that. And that'll continue over the next few months. And actually, it'll continue for the lifetime of our partnership. So it'll be intrinsically linked to the OD network for the partnership that Joe Farn and Kate Sims are working on, as an example. We're working quite closely together to make sure those two things align. So the draft of the strategy you've got before you today builds on the proposals that we brought to the September board. If you remember, we brought some of the feedback from the sort of the formal and informal consultation that we've been doing. And as Rob mentioned earlier in the meeting, that's really built from those place health and wellbeing strategies. It's quite a lengthy document. I do appreciate that. We started with an ambition to keep it as short and punchy as possible. However, our system is so complex that it's been necessarily quite a little bit longer than planned in order to be able to better describe an integrated system which is really connected to itself. And we've found that through doing the engagement, we've connected with people we just wouldn't have connected with before. It's been an absolute joy as well to be able to bring those people into the work and to be able to gather their skills along their way, their insight. It's been a fantastic process. So it's been a culmination of really widespread engagement and insights gathering from across the design group. They've been going and doing a lot of the engagement themselves, sometimes with us and sometimes on their own, covering a mixture of formal and informal groups. So we've done some of what Ian's described, the health and wellbeing boards, the joint overview and health scrutiny committees, but then we've been to a whole host of other formal groups and smaller groups. Some of the conversations we've had with groups such as the voluntary sector groups have been fantastic and really driven some of the work, particularly around the enabling strategies, and then also that data and the insight from the population as well. We know that there are some areas we need to strengthen in the strategy, particularly in terms of the challenges around adult social care. I'm not quite sure we've got that strong enough in there at the moment. Also linking to some of the clear evidence we know exists, such as the Child of the North report as an example. And I'm also noting, as a result of the previous item around the fantastic creativity work that's happening, I did have a conversation with Robin, Yasmin and David around that, and I need to weave that in as well. We're also continuing to work with colleagues in Wyatt as they develop their strategy to make sure that that's truly joined up as well. And we're also working with the leads for our enabling strategies to make sure they're able to help us deliver this strategy, as Kate alluded to earlier as well. So the draft covers all of the asks of the integrated care strategy guidance that was published earlier in the summer. And I must admit, it covered a huge range of areas in that guidance. And my reflection is that it shows that we've got a real maturity of a partnership, because when we looked through it, none of it felt out of kilter. It all felt like it was work that we already do, people we already engage with, which was really fantastic to see. That includes things such as the trauma-informed work you've just been hearing from working with the justice system, working with the combined authority as really good examples of that. So NHS England have asked us for a copy in draft in December, as Ian describes, but this is very much our first draft for comment. So we've got planned into all the Health and Wellbeing Board meetings and joint health overview and scrutiny again in the new year. So we already went to them in the summer to gather initial thoughts. We'll go back to them with this draft. And then we also want to make sure we weave into the next iteration all the comments from today, from these meetings that we'll go to in the new year, and any additional comments we receive direct. Every comment is really valuable. And then we'll bring a final copy back to the board at the March meeting. We know we won't have got everything right in this one. It's a really complex system and we need everyone's help to be able to get it right. So lastly, the work also now turns to developing plans to deliver the strategy. As Ian described, the joint forward plan is coming up, not just the physical plans, but also, as I've mentioned, how we work together to deliver this as well. So we'll be working to ensure that aligns with our operational planning as well. We've got a session just before Christmas to look at some processes around all of that to make sure that we can pull everything together to show how we're delivering a strategy. So a big part of that will also be building an evaluation into our plans. We've already had some discussions in our group about how we can bring together NHS England oversight, 10 big ambitions metrics, and then also getting much better at factoring in public experience and how we embed that into everything we do, so that we can make sure we've got some really rich insight into how people of West Yorkshire are really feeling that impact of delivery of the strategy, and that's just so important. So I don't know whether there's anything else you want to add, Ian. If not, I'm happy to take any questions or comments, or if Bilal has joined us, whether he has any reflections he'd like to give from his time as a fellow working on this as well. But I haven't teed him up for that, so it's a bit of a surprise. So don't feel like you need to say anything, Bilal, if there's nothing to say.
I guess the only final thing, which is probably stating the obvious, is that the version that you've got is the fairly flat Word document. Once we've got a set of words that we're happy with, that's when we'll make it look much more attractive and get the right sort of links in and the right case studies and those sorts of things. But apologies, you were going to come in there, Bilal, weren't you? And I just
I was going to say probably one of the this is the way we've done this strategy is probably has been a lot different to any other strategy I've been involved in. The amount of engagement we've done, and the key thing we want to do is really hear the voices of different citizens and colleagues across the system to make sure that we create something that we're proud of and, you know, is meaningful to the citizens of West Yorkshire.
Thank you. Okay, so I've got a number of people want to comment, so I'll take a few comments and then perhaps come back if there's anything for you to pick up on, Ian, so, or Esther. So I'll start off with Max and then Thea.
Thanks very much, Chair. Can I just commend and compliment Esther and team, please, for the clarity of the draft strategy document. I really do like it. I appreciate there may be other views expressed, but I think it's terrific. In particular, I'm really pleased to see the clear metrics and the timelines of those metrics, so we can all understand as a group quickly where we've gone, what the journey's been. That's terrific. So I do want to commend those, particularly the clarity of the metrics and timelines. And my quick question was just, how often might we as a partnership board get an update on those? It was what we felt would be right in terms of how often we should see the progress on those 10 ambitions, particularly 10 ambitions. So thank you.
Thanks, Max. Thea and then Kathy.
Thanks. I'd agree. I think it's really nicely written and it's very easy to read, which is remarkable and useful. I think there's something important about digital that doesn't come out strongly enough. I think that digital is an answer sometimes to some of the workforce challenges that we face and the way in which we'll think differently about technology. And I don't see the interaction between that huge strategic challenge we face as a partnership, which is workforce, and then the range of options linking into digital. So I just think that reading it through, and it is an easy read, which is brilliant. I didn't feel the story of digital came out strongly enough. I don't think the story of information comes out strongly enough either. If we're going to have population health management and we're going to work on a neighbourhood level, we're only going to do that because we have the right data and information at that level and we utilise it in that way. Again, I think there's more that could be linked in there to demonstrate it. I also think that quite a lot of this in terms of neighbourhood working with the population requires a different relationship with our population in terms of the power they take for self-care and self-management. And you talk about self-care and self-management really, really well. And we've got lots of great examples of where people do that. But it's not the easiest ask. It is actually a different relationship sometimes we're having with our public to take them on that journey. And I think that's worth pulling out. And my final point, which is maybe a downer point, this isn't all going to be easy. It's written in a terribly optimistic uplands, highlands. This is where we'll be. I wonder if there's a little bit of reflection in, we know there are challenges, significant challenges, and the things that will get in the way. So just going back to something like communities and working at a level, it is really complicated because of things like the different business models in primary care, the different business models in the voluntary sector. And I think there could just be a bit that says, we know these are big challenges and we're committed to working on them. Those are my comments. Thank you.
Thank you, Thea. Kathy?
Thank you. So I've been supporting Ian and Esther along with other West Yorkshire colleagues on the result of this. So I think the fact that we are consulting and engaging and therefore co-producing this is really welcomed. And we are much further ahead than other systems who are starting this strategic journey. So I think there's a few points which most of which Esther and Ian are aware of. And I've just put in the chat box, making sure that we're referencing a number of national reports. It's good practice, but there's also things to take on board and learn from that. So you can already see the reference to fuller stock take on primary care and neighbourhood working, the Ogden review on maternity services. Tim, you and I are very passionate about women's health, and there's a government women's health strategy, which came out in the summer. And there's lots of great recommendations there that I think we can weave into this work, which Esther and Ian, I know you're aware of. And I'm pleased that we need, as you talked about the Child of the North report, there's something about being a northern health system and the types of populations that we are serving and supporting that we must take on board as well. So that's really welcomed. I think what's really interesting in this is we're talking openly about poverty and our role in that as a health and care system and how we're tackling that. And we're going to come on to cost of living crisis. So I think I'm not sure, for those of you who've worked in the NHS perhaps longer than I have, how often have we done that and talked openly and worked together to tackle that? So think that's an interesting area of work, and Theo, I understand what you're saying and being realistic as well on the delivery opportunities. I think there's something around the data, and I've been someone who's been asking for that data, and Max, you can see it there. I think it's incredibly helpful. But what more do we need? The NHS provides us data, local authorities have a data. Frankly, we're awash with data. But what information and metrics do we all need together to mark and track the progress of the outputs and the outcomes? And I know Esther and Ian have been working hard on this with others, but I think there's being open-minded and creative in this. In working with the NHS data, for example, that many of us need so that we can report and evidence our progress. But what other things do we need as well that show that we are a progressive system? So, Ian, I'm not asking you to give us a full response, but I think there's something that Ian has raised before with us as a partnership, is that we need more resource and capacity to do the business intelligence so that we can mark this progress. So there are more comments, Tim, than anything else, but I'm really grateful for this strategy coming through and the fact we've got a little bit more time to refresh and enhance it. And I think in making sure that it's built from places, but it's also then how places would like to take this strategy on from April and set their own targets, say for 6 to 12 months or so, as well as over 5 years. So they have ownership, but it all connects back to the strategy so that we are in that circle really of making sure that places are informing the strategy, but we also have oversight of it. But thank you, Esther, Ian and many others for bringing this together.
Thanks, Cathy. I just want to check before I go to Susan and Gary, Ian or Esther, is there anything those three you want to respond to?
I mean, really helpful, and it's interesting theory, isn't it? When someone has a fresh pair of eyes and that you spot the digital and data stuff, and I think you're right, it could come across more strongly. I think your point around tempering the tone so that it feels like a kind of reality that people recognise is helpful as well. Max, on the metrics, I think the challenge we've got with a lot of those metrics is they move slowly and they're quite badly lagged. So what we've been trying to do, particularly around the inequalities ones, is look at things like, the determinants of inequality, like smoking rates and those sorts of things. So we've got something that's almost like a lead indicator that you can track a bit more readily. I absolutely think we should be bringing this routinely to the partnership board. It might be that we do it annually as part of the annual refresh process or before the next refresh, so we can see where we've got to. But we can look at that. I think your point around connections to other important documents and that sort of thing that we're doing around what it is to be a Northern ICS, Cathy, and our role in economic growth is really important too. And yeah, loud and clear on the BI side, it's something that we're working on. So, but it's really helpful, and just the fresh perspective on it is really helpful. Esther, I don't know if there's anything you want to come in on.
No, just that I think that they are really helpful comments, and I agree, Thea, on the digital and the information and the self-care stuff. It's just not strong enough in there, and so it's so helpful to have other people reading it and providing that sort of support to it, so we can go back through and make sure that we've got the right expertise and the right information woven into that. Thank you.
Okay, I'll take another batch of 3 or 4 comments then. So starting with Susan and then Gary. Susan.
Thanks, Tim. So first of all, I just wanted to check, are these metrics and these ambitions the same as the last ones we had? Because we all did those recently. I'm very keen when we look at data to make sure it continues over the years, because otherwise you chop and change metrics, you never learn anything. So I just wanted to check that. Other people might have noticed that better than I just couldn't quite figure it out. I love data, so I've spent a long time poring over the data in the appendix, which is very interesting, trying to track where we are compared to other neighbours. I think, following on from Max's point, I think it would be good actually if we could shape the agendas that we have throughout the year to incorporate one of these at each meeting. So perhaps a group of these, so we can say what we're doing to tackle it, because otherwise it's just happen chance that we're making improvement, isn't it? We're not all making a concerted effort to make it work and to work together about learning how do we actually change what we're doing to hit some of these metrics in a better way. So I'd like to see more focused working on it. And I think once it's finalised, I'd like Cathy and Rob to go down to Westminster or wherever these NHS England people sit and present it to them and say, thank you very much. I know you're doing a strategy. Here's one we prepared earlier and we'll be working to this. Thank you very much. Thank you.
Thanks, Susan. Gary and then Robin.
Yeah, thank you, Chair, and thanks to Ian and Esther and everyone else who's worked on pulling this together. I think it's a great refresh strategy, and I agree with Max that the metrics that are presented here are really clear and informative. Really reassured to see the Healthwatch insight so strongly mentioned in that, and the voice of the public leading the direction of travel of this strategy refresh. And just to sort of pick up on Kathy's point earlier about the sort of future way we look at the metrics and how we develop these. I think the metrics that are in there are quite quantitative at the moment, and I think there's something around finding that qualitative voice as well. And I don't know what the answer is, but I think there could be some way of ensuring that we keep coming back as a partnership board to reflect on what the public are saying and set ourselves a target in this strategy to commit ourselves to doing that on a regular basis. And now, whether that's through sort of the monitoring of regular insight reports through Healthwatch, or if there's another way of doing it, I'm happy to explore that. But I think I'd really like to see some ongoing commitment in the strategy to making sure the voice of the public is included as one of our metrics going forwards. Thank you.
Thank you, Gary. Robin, and then I'll come back to Esther.
Councillor Hinchcliffe's last statement was kind of what I was going to say. I just wonder about, just well done to Esther, really, and the team. And it's just incredibly difficult. We all sweat over these things, and they're really hard to get right. And I think you've done a great job. There are some bits like social care, digital, but I think it's really impressive. So well done. I just wondered about our tone of voice at the beginning, and just where we are at as a partnership. I know we're only 5 years old, so we're only starting school. But almost, I think we should try and pretend we're entering adolescence, and we're starting to find our feet and actually start kicking against things a little bit gently, and saying the world is needing to be sorted out. And the whole taking the Councillor Hinchcliffe's comment about going down to Westminster, that the content should be framed at the beginning by, look, this works, and we can show it works, and we're committed to this. And almost it should be an advocacy and almost a lobbying document about the purpose and value of collaboration and system working at this scale, but also in place. And so I just wondered, there's something about our tone of voice and whether or not we just need to move on some of the. So I know that 15, 20% is NHS, the rest is determined how. I wonder whether we almost need to move on from that into a more mature kind of, it all matters. But we need to focus on the things that really matter. We know, prevention, early intervention, done well, targeted effectively, drawn from people, community, neighbourhood and place, changes lives and reduces other demand in systems. There's almost a sort of, I think there's an assertiveness about the way we do things that we need to just be a bit stronger on in the opening bit. Otherwise, I thought it's really good. And almost it becomes a document that we go out and share with the world and tell the world, look, this is not that we've got it all right, but actually we've done enough of this now to know some things work, and we should be really quite assertive about it and see this as a document with a lobbying potential, not just something we write because someone's told us to write it. Thanks.
Thanks, Robin. Esther?
Thanks, Chair, and I completely agree, Robin, about the tone. I think that's it's a brave tone to sort of almost take up that mantle of influencing, isn't it? Gary, just to reassure you, we've had some really interesting conversations and workshops around public and patients experience over the last month. Some really fantastic, brave people have come and shared their stories about the fact that actually they might not have hit any metrics for NHS in their care, but they had a wonderful care experience, trying to get people to think about it differently. And Karen Coleman and her team are working with us to try and embed public involvement into transformation, into planning of services, into planning of everything we do. So, and I think Healthwatch will absolutely be involved in that as well. But just to assure you that that's a huge part of our work, using that data, but bringing it together with some of the real richness of how people genuinely feel on the ground as well.
Thank you. Rob?
Yeah, thanks to everyone for the work that's gone into this. I attended one of the workshops with Falk, and it was really good to see the degree of challenge and interest in the strategy. I think, so in terms of the content, we had a discussion earlier about creativity and health, and it would be good to see that more strongly reflected in the strategy, which links, I think, to a need for us to cross-reference with the Mayor's pledges and the role of the combined authority more strongly, and the economic recovery plan that we have in place. And also, I think learning from the pandemic would be good. My main points, though, are that I think what we're hearing is rightly, we've got to get the tone right, and we've got to get the strategy to reflect our personality. I think I've heard Robin and others in the past, I think Helen might have said it doesn't sound like West Yorkshire. You know, how do we get it to sound like West Yorkshire without it being cultish? So the tone's got to be right, and I think there's as ever with me, there's three kind of things I'd want to see in there being really clearly stated that reflect that this is a partnership. And the first is that the 10 asks, what do they become post-pandemic? Living with COVID and in the crunch that we've got economically. And I think we're talking about 12 or 13 asks, 12 or 13 ambitions. Should be really clear what they are. And as Susan said, most of those are a continuation of what we've done before. Second thing I think is we should make sure that it allows us to pass the tests that were being set. So how do we become data enabled? How do we use people and their assets to co-produce everything? How do we make sure that we manage the money? How are we going to overcome the people challenge that we've got? There are a number of tests that we've got hitting us in the face that we're going to have to overcome. And this strategy's got to overcome them. So people, money, technology, transformation, improvement, all of those things. So the ambition, the test. And then the third thing I think we should be really clear about, which goes to Robin's point, is what we're asking for. So if we're to be successful, some things have to be true. So there has to be capital for Leeds Teaching Hospitals Trust to be redeveloped, for example. That's an easy one. We want there to be a regulatory framework that works. We want council funding and public health grants to be appropriate, etc., etc. But we might want to put something like that in this strategy, that our assumptions are that this can be delivered if the following are true.
Thanks very much, Rob. I'm not seeing any other indicators, any indications. I'm sure there'll be people who will have comments and views and not have the opportunity to feed in, and would encourage you to email Ian and Esther with them. Is there anything else you want to add, Ian, Esther?
No, I mean, really helpful, and thanks very much for the positive feedback, because there has been an awful lot of work going into this, particularly from Esther and the team. So we're really grateful for that. I think the comment on the tone's really interesting, isn't it? Because it's really easy to say, well, the tone's not quite right, but it's really hard to write something that's got the right tone. So we'll keep looking at that, and Robin, we might ask you to get your pen out. I think I hadn't really thought about this in the context of the lobbying sort of document, and what are the asks, and what's the sort of relationship we're trying to establish with NHS England. But I think we can get some of that in, and I think we can probably get that in at the top where we're talking about our partnership. So it's a helpful thought, and I just don't think we'd thought about using the document in that way. But yeah, really helpful. I don't know if Esther's got anything to add.
No, just it's all really really helpful to sort of do some final tweaks, and obviously we'll quite possibly have quite a bit of comment come back from the Health and Wellbeing Boards and the Overview and Scrutiny Committee as well. So it'll be interesting to see what they say. But all fantastically helpful. Thank you.
Okay, so 2 further contributions from Diane and then Kathy. Diane.
Thanks, Councillor Swift. Yeah, so overall, I think the strategy is very good. I think there's a lot in there that's very ambitious. I'm not seeing any reference to maybe what I would term the sort of commercial sector, or how we might interact or use the commercial sector in the future to the benefit of our system and the providers within our system. So I'm not sure whether that's an appropriate comment for me to make. It was deliberately not there, or there's a different approach to that. But I think I'd just be interested in what the sort of thinking was behind there, because I know in this meeting we have talked before about how we embrace it, how we make it part of the wider system and get the benefit of it, but I'm not kind of picking it up in there unless I missed it, of course.
I come back on that?
Yes.
It's not a glaring, not a deliberate omission, Diane, at all. And I think there's a little bit of, certainly in terms of the independent sector for social care, that's absolutely something that perhaps needs to be part of that, how we're working to resolving some of the challenges as well. So it is an important part of the system, isn't it? So that's something we'll take away and reflect on and look at what we need to do around that.
Thank you.
Thank you. Kathy?
Just a brief comment. Ian and I have been working with colleagues across the north of England in other systems on exploring, I suppose, both the needs, the issues and the opportunities and the strengths of working in health and care across the north. And Ian's just talked about health tech there, which is one of the strengths, as well as pharmaceutical industry in the northwest. So we'll keep colleagues updated on the results of that work, because then that also demonstrates economic and social development contributions as well. And I can see Alan from West Yorkshire Combined Authorities joined us as well. We will be featured in a NHS Confederation national report later this month on the ways in which we work on making contributions to social and economic development. So I'm pleased it's referenced in the strategy, but I think we've got more to do. And when it's ready, we'll share an update on the work across the north of England as well.
Okay, thank you very much, everybody. And seeing any more, I'm going to move us on then to the final major item on the agenda, which is the working partnership to alleviate poverty. And I think we've got Ian, Frederic, and welcome Alan Rees from the Combined Authority for this item. So Ian, over to you. And
yeah, thanks, Councillor Swift. And if we may, we'd like to share a short video just to start this session. It's from the Leeds Poverty Truth Commission, and it's a bit old. It's from October 2016, and it was produced for the United Nations International Day for the Eradication of Poverty. And it's a series of experiences and perspectives of poverty in Leeds and people's thoughts on how we might work to eradicate poverty. So it's really helpful in terms of framing the next conversation. So if it's okay, if Lauren can play this little video, that'd be great. Thanks.
In Leeds, we're surrounded probably by poverty, and a lot of times it's not something that you recognise till you make a deeper connection with a person and realise what type of poverty they're in. If they're in poverty of isolation, if they're in poverty of hunger, if they're in poverty of depression. There's many different types of poverty.
Poverty in Leeds to me means unequal opportunities. Like, you've got no right to shop in this area. You've got no right to actually live in this area.
Well, unemployed, can't get a job, and I've had lots of sanctioning a while ago now. And it was hard to get food at the time when I was sanctioned. I couldn't get electricity here out. But hard. I had to borrow off my sister all the time. And I had to go to food banks when you don't get proper food. You get tins only, you don't get meals.
Well, my experience of poverty is mainly to do around children, because I have 7 of them. So it was always sort of saving week by week to go get them shoes, like for school and that, to buy them at the same time. Not being able to go on holidays and stuff because never having enough money to take them on holidays. So we used to do sort of day things during summer holidays and things, so at least we would still be doing something.
Housing has been an issue, because when we are seeking asylum, we've been sharing a room, whether small or big. For me, I shared a room where I couldn't stand even straight, or, it was too tiny for me.
A lot of people don't mean to do it, to ignore poverty. It's just that it has to be really something that's brought to their attention or that is particularly poignant to them. something, you know, an incident or a person that really makes them think about poverty?
Yeah, in my country, there is poverty is there is quite big, because it really starts from what you are going to eat. But I think here I think it can be addressed.
In my opinion, to solve poverty in Leeds or to challenge it, you need to invest financially into its surrounding communities, so not just in the centre of the city.
Eradication of poverty, what would that mean to me? That would mean to me that, you know, every child got fed, every child's needs were met. That's within schools, that's within sports, that's within a whole range of stuff, especially around children. They need to be achieving their potential.
Don't constantly try and think that poverty can be solved with grand schemes. It's solved one small step at a time, and that can be something as simple as a small community organisation in Seacroft, like LS14 Trust, you know, bringing people together.
Well, poverty, you think it's about having no money and food, but it isn't. It's people having no love and no respect for each other. And I think that's what's missing, no love and respect. It needs to be brought back into people's minds.
Right, thanks very much, Lauren, for sharing that. So you'll remember that in September we had quite a detailed paper and quite a rich conversation about the rising cost of living and the impact of that on the health and care sector, both in terms of the impact it would have in terms of people needing care, as well as the impact on people working in the health and care sector, including volunteers and carers. So following that conversation in September, we took an action away to get a smaller group together, which included relevant stakeholders across the system, including sort of the poverty leads in local authorities, to turn that rich conversation into more of an action plan, a set of things that we could agree to do together as an ICS that we believe would make a difference over this winter. I'm really grateful to Deborah Harkins, who unfortunately can't be here today. She's the Director of Public Health in Calderdale, who pulled the group together and who's done much of the legwork on this. I'm also supported by Freddie Garb, and I'll hand over to Freddie in a minute, and Alan Rees, who's the Director of Strategy at the Combined Authority, who's been working on this with us. What the document does is it presents two things, really. The first one is a statement that we'd like to put on our website on behalf of the ICS, and the West Yorkshire Combined Authority want to have as a joint statement for WICA 2, which is recognises the issue and sets out our commitment to working with people on it. The second thing we've got is quite a detailed list of potential actions we could take. From the conversation that we had in September, we pulled out four sort of real themes, I guess, in terms of what we could do as a health and care system. The first was actions that we could take to support people working in the health and care system, recognising that, you know, of the 110,000 people we've got working across West Yorkshire, a good chunk of them are likely to be in poverty as a result of the rising costs this winter. The second is the work we can do around suicide prevention services and supporting people's mental health, because we know there's a direct link between economic issues and mental health issues. The third is the work that we might do to support the voluntary and community sector during this period, recognising they're likely to be disproportionately impacted by cost rises, and they provide a really key role in supporting people. And the fourth one is about how we might work as a health and care system to build sort of thinking about poverty into sort of our core way of working, including sort of the work we do around anticipatory care through primary care, how we connect it to sort of core processes like winter planning and oversight processes, and those sort of things. So it's quite a detailed plan, but hopefully it gives us a lot to look at and potentially some points of agreement in terms of collective action. But before I bring Freddie in, Alan, is there anything that you wanted to say from a West Yorkshire Combined Authority perspective?
Yeah, thanks very much, Ian, and thanks everyone for having me today. Really pleased to join for this session. I think from a Combined Authority perspective, I mean, Ian has already touched on the work that's been done to look at the current crisis in the cost of living in West Yorkshire. And as a Combined Authority, we have been thinking about and taking action on what we can do. So the Mayoral Combined Authority, as well as being responsible overall for the transport system within West Yorkshire, tends to focus on longer term economic development issues around supporting businesses, skills, etc. But we recognise that this is an emergency, really, and our analysis shows that 10% of households in West Yorkshire aren't going to have enough money to pay their bills this winter, and that constitutes a crisis in the cost of living. We also think that there is a crisis in the cost of doing business for a range of reasons, and so there are a number of actions that we are taking, working with the mayor and leaders, and also the local enterprise partnership, and some of those are articulated in this paper. And in particular, one of them is the work with the voluntary and community sector. So Ian drew attention to the support for the voluntary and community sector as one of the key priorities. The Combined Authority has approved a £3 million fund to help support people with food, warmth and mental health, working through the local authorities, and then the funding going to the voluntary sector to support the vital work that they're doing within communities. And the other thing to mention that's also in the joint plan, because I think it's highly relevant to those 100,000 people working within the care system, is about the cost of travel. So the Combined Authority has allocated funding to reduce the cost of travelling by bus within the region to £2 for a single, and that is an example of how we can reduce the kind of day-to-day living costs of people working within the system. So really pleased to have been a part of the conversation about this, and to have supported Deborah in shaping some of the work here. There are other examples of where the Mayoral Combined Authority and the ICB are working together, particularly around the wider determinants of health and equality, diversity and inclusion. But for today, really pleased to be here to support this and be part of the conversation and explore hopefully how we can take forward some of the actions that are put forward within this paper. It's also worth saying that a similar paper which refers to this action plan is due to go to the Combined Authority on Thursday, where we're taking a broad update on the crisis and the cost of living and doing business, and it mirrors the statement which is set out in this plan. Thanks, Ian.
Councillor Swift, I wonder, in the interest of time, whether it's worth just opening it up to questions at this point. I think you've had the paper and you've had a chance to see what's in it, so we might just want to do that. I'm conscious of the time.
Certainly, yes, Ian. Let's do that. Fiona.
Thank you, Chair. I realised I didn't introduce myself earlier. I'm Councillor Fiona Benner. I'm the Cabinet Member in Leeds for Children and Adult Social Care and Health Partnerships, and I chair our Health and Wellbeing Board. I've got a few comments on this paper. My main comment was that I thought there was a significant omission in this paper, in that in the section about staff and volunteers, there were some really fantastic things in there about destigmatising, talking about money and support for staff, but it doesn't say anything about staff pay. And I think the most significant way the health and care system can mitigate the impact of poverty on our staff is by paying them properly. So being a real living wage employer, I think, is a target. For example, the ICS is an employer itself, but also all our organisations are as well, and that we're big employers. We're anchor institutions in Leeds Health, and I'm sure it's the same in the other areas as well. Health and care sector are a major employer, and I have to say this was acknowledged by one of our chief executives in Leeds when we discussed poverty and the cost of living crisis at our Health and Wellbeing Board. One of the chief executives actually. I think that's a really, really significant omission, that's the biggest impact we can have on our staff, and poverty is paying them properly so they're not in poverty. And my other 2 points are in relation to mileage. I wonder if it's worth including anything about promoting the use of things like pool cars. We've got a big electric fleet in Leeds, and we're starting to use pool cars for things like social workers, things like people like social workers doing their journeys, which obviously benefits the climate emergency, as well as, meaning staff aren't using their own cars. And then I also thought there should be a bigger emphasis on housing as an issue, and specifically health and housing. We've got a health and housing board in Leeds that I chair, which is focusing on things like selective licensing, work in high rises, which it feels really significant given we've just had the death of the little one in Rochdale. That's like really specifically attributed to damp and mould in his home. So I kind of feel actually there should be more of an emphasis on housing as a significant health issue as well. But my main point I wanted to get across was about staff pay in our big organisations. Thank you.
Thanks, Fiona. I'll bring Susan in as again, make a couple of comments in the end and then come back to you, Susan.
Yeah, thanks, Chair. I was going to make a similar point, actually, that how do we make sure that as anchor institutions we're making the most of how we purchase, how we employ people, to make sure that the wealth that we can create locally is created to its maximum. So I think that's really quite important. And albeit I know Alan said obviously this is an emergency now, but the long term and medium term, in fact, growth of our economy in West Yorkshire is absolutely vital. It is just as important, because otherwise we'll have a crisis every year and never get out of it. So a real focus on anything we can do for growth. And that's why with the new hospitals, plural, whenever they happen, it's really important we make the most of those for our local economy as well. Again, thinking about that as an anchor investment to be able to support the local economy and jobs, etc. So the real way out of poverty is to try and get people good, skilled jobs, which is going to provide money for themselves and their family. And unfortunately, at the moment, that's quite tricky to do. So the growth is really important. So let's keep doing the growth element, do what we can as anchor institutions to support that growth locally.
Thank you. Mel.
Thanks, Councillor Swift. We had a Health and Wellbeing Board in Bradford District and Craven, and we signed off our anti-poverty strategy with a request that all the constituent parts of our partnership would take that document for endorsement in their respective governing bodies and boards. So that is in train, and instinctively looking at this, there is very little that I can see that would jar with that, and much that would align with it. And indeed, listening to, I had to dip out, but I'm aware of Kim's proposals around some of the resilience of the voluntary sector, which is again captured in this document. At our partnership leadership exec meeting on Friday, we signed off a proposal by our voluntary sector representative that mirrored much of what Kim aspires to see done across the whole of West Yorkshire in terms of making that a more resilient offer and looking at some of the things that get in the way of that and supporting that voluntary sector. So I would propose that we take this back, and at the same time as we're endorsing our Bradford District and Craven anti-poverty strategy, we sit this alongside.
Thanks, Mel. Right, I've got Anna next.
Thank you, and thank you for the prompts as well, Rob. Just wanted to advise that we've been doing some work which I think is important in helping to support actions to address poverty around social value generation through our capital investments. So I know other areas have done this and developed where you've got opportunity to invest and make investment in your estate. that your supply chain and your contractors are set targets around making sure that that helps to generate local jobs, but also that those jobs are targeted at those people most in need of employment, so either long-term unemployed or other vulnerable groups within your communities. So we've developed those plans both for the new Accident and Emergency Department in Huddersfield, but also hopefully for the developments that we'll be putting in place at Calderdale Royal Hospital. I think it's a really important way of supporting the local economy, reducing poverty. I'm pleased to say, because our new Accident and Emergency Department is about halfway built now, it's on track for completion in July, that we are, through monthly reporting, seeing evidence of both those local jobs that have been created, apprenticeships that have been created, and also confirmation that we're using local supply chain. Our main contractor is committed to doing that for the supply of things like local stone as well. So I think, you know, we've talked about our anchor organisation role. We have big leverage across us, don't we, around our broader investments, and to really make sure that we do target those. The social value action plans that we developed, and I'm sure people will be aware of this, we did that using information held by our 2 local authorities around where the greatest health and inequality needs were in our communities regarding employment and other needs to be able to support that. So I just think that's a really important another way to address this and give longer term greater hope for people to move away from poverty.
Thanks, Anna. Yeah, that's excellent. Thank you. Kate and then Kathy.
Thank you, Chair, and thank you, Anna. I thought you made some really excellent points there. Just coming back to, I think, the workforce action plan, at that first steering group meeting, there was a balance. I think we really looked at the fact we are large organisations, and I think as both the councillors have said, I think there's something about making sure we use that. And I think the growth comment is a really important one. You know, where we've got growth, where we've got opportunities to employ, we need to ensure that we look at our local communities. And certainly I think that was one of the ambitions that's linked to the wider people strategy. There's something about making those opportunities accessible. And I know there's lots of work happening at places around that, and really ensuring there is local employment is a focus. I think the purpose of the action plan, we'd identified a number of really good areas of practice, and there's something about challenging ourselves to say, why can't we have that right across the board? And I certainly think that would be one of the ambitions. I certainly understand the point that's been made around pay. And you know, we need to go back and question, are we being ambitious enough? But I think a comment that's been made in the chat was one of the points that was raised in the steering group, is that the starting positions of our organisations are quite different. So I think it's something about exploring the possible rather than saying this is something that we can do at this moment right across. And certainly when we got into some of the mileage rates issues, as an example of that became more challenging in some of the sectors. I think Hilary and Kim have made that comment in the chat. So I don't say that it's not an ambitious action plan, but I think it's something that we're just trying to make sure we've got that balance right. Thank you.
Thank you. Kathy?
I'm really pleased that we've worked quickly on this. So we only talked about this at the last meeting, and here we are with an action plan, and it's great to see that certain programmes or certain people are leading on this. I wonder, Tim, if after this meeting, if colleagues are willing to take this action plan into their own organisations, talk through where they may prioritise, and perhaps come back and share case studies. And I think Anna's example on supply chains as a medium to long-term aim is great, but also do we have shorter-term examples as well? And Ian, my question, which I've already said that I would ask, is if everyone walks out of this meeting, what's the 1 to 3 things that everyone should do in the next few weeks to implement this? I think there's something around working on social value, working on supply chains, acting as anchor organisations. We did approve at the ICB board meeting in September the financial strategy and principles. I think that gives us a good basis. That gives us a basis, for example, on sustainable and respectful contracting and commissioning of the voluntary community and social enterprise sector. It also encourages us to use the Social Value Act. And then alongside that, I hinted at this earlier, the NHS Confederation are bringing out a report later this month on the NHS's contribution to social and economic development. And there's some good examples in there, including work that we're doing ourselves. And I wonder how we take this forward. And I can include that in one of our chairs and leaders exchange sessions into the new year as well. I think some of the interesting things in taking forward is how we step out and do other things like working with energy suppliers. Perhaps that's a discussion outside of this meeting, but I'd really hope that this action plan, it's good to have programmes, good to have names, but I wonder if there's some champions that may want to take on aspects of this so we get it done and we get it delivered. And I hope colleagues will take this into their own organisations in the coming weeks.
Thanks, Kathy. Aware there's an awful lot of different points being raised. I've got 2 more contributions, and then I'll see whether Ian, if there's anything your colleagues want to cover in summing up. Rachel.
Yeah, so I've put it in the chat, but there's a link to a report from JRF that's just come out around levels of insecurity and mental distress that I genuinely would recommend everybody have a read, because I think we kind of underestimate that absolute direct causality, and it's not just about absolute income, it's about all of the other causal factors for insecurity. But to quote Mary, who you just saw in the video there, she was at a meeting with me once. She went, "That's all very well, but I'm the one going home to no milk in the fridge." And there's something about that I think as a system we can commit to making sure that whenever and wherever we have a relationship with somebody who may be in poverty, that we are making sure that they know where and how to get help. So I think that is something that we could all test ourselves at, which is, are we absolutely confident that every single one of our frontline workers in every single one of our organisations knows where to send people, to support people, to get help and to get that practical support and assistance? Because I think we know that, again, in that kind of insecurity vortex, good help quickly can be absolutely gets people off that hamster wheel. We know it's incredibly expensive to be poor. It's even more expensive I think it's the most expensive winter on record for being poor in terms of prepayment meters and costs and all of the direct costs that we're associating with people. So if that's the one thing that we know in terms of that early help can get there, and we know that we've got high levels of trust and trusted relationships in our health and care, that's something that we can all do and make sure that we've got that. And everywhere's got really good signposting information, but I think it's that important thing of when and how we get that signposting to people and making sure we support people to getting to it, that I think is the big difference that we can make today.
Thank you, Rachel. And Tholuke?
Yeah, thank you. Really good to see this. And like many colleagues have said, we have a range of things we're developing in our organisation around this strategy. I think one of the things that I think would be helpful to think about in the context of the workforce element is volunteering. Because I think if you think about the Maslow hierarchy of needs, the need to have purpose in life, when individuals may not feel ready to either take an apprenticeship or formal employment, the opportunity to offer them voluntary work that they can come to regularly, engage with people, and the context about mental insecurity, actually that can start to help address some of those issues. And I think volunteering for all ages. And I'm reminded very recently, I was handing out awards at our organisation, and one of the recipients was somebody who had just been appointed as a supervisor in our gardening team. He started with us 2 years ago as a volunteer, and he just came to help out in the gardens, and over time built trust that enabled him to then settle with us as an employee. So I think sometimes thinking about how we can support volunteers into the organisation that may or may not lead to employment for themselves or for their loved ones actually might be something else we need to think about as anchor institutions.
Thank you. Okay, Ian, are there any points your colleagues want to pick up in responding?
Well, firstly, thanks for all the engagement contributions, really helpful. I think there's a few things that I'm picking out of this. Firstly, there's some ideas that we can look at and potentially add in. Some of the stuff around the health and housing work. We've got a network looking at those anyway, so we can add that in. The ideas around carpooling and volunteering. I think those are things that we should look at, and if we can quickly add a line in the nose, we will do. I think that the second thing that's coming across quite strongly is that there's some short-term things and then some longer-term things on this agenda. And I think the work that we're looking to establish as part of the improving population health function will need to have that shorter-term and longer-term view. It's not going to work this winter and then stop. And I think being able to separate the short-term actions versus the longer-term things that we might want to influence over is going to be important. I think Mel's description of what she's going to do in Bradford is exactly how we want this to work. So taking this report back to place arrangements, place committees, and saying, look, does this feel right? Are we doing this stuff? I'm not hearing that any of this stuff's wrong. So taking them through those arrangements and trying to get ownership across organisations in places is essential, I think. And if places could commit to doing that, that would be brilliant. And to Kathy's point around the sort of what are the things we might do, I think it's that. I don't think there's anything in this list that is particularly radical and isn't being thought about. I guess what we're trying to do is have collective action around the totality of these things by taking them through those place committees and taking them through the appropriate organisational governance. So we'll write after this with a slightly revised action plan, but if that's something that we could collectively commit to, that would be brilliant. I wouldn't mind just seeing if there's anything that Freddie wants to add in the last minute, because I'm conscious she's done a lot of work on this and joined the conversation. I didn't let her speak. Freddie, is there anything you want to come in on?
No, I think, especially in a minute, basically, there's a lot to say, I think, and really welcome all of those comments. And as people are saying, there's a lot of work going on. And I think, as Ian is saying, this is about some of the systems work. So obviously really encouraging and supporting work to continue at local place and how we can support some of those efforts and exactly like those longer term goals as well, actually, so that this isn't just a quick fix, because this is certainly a problem that's going to stay with us. And as we've said, obviously, there's a clear link with the climate change and environmental agenda as well, actually. So I think it's really important that we consider them together. So it's really positive that everyone is taking that forward and taking that ownership so that we can take that collective approach around it, as Rob referred to before, about that learning from COVID. So I think it's a similar approach that we're hoping to achieve by all kind of working together. So thank you.
Okay, thank you very much. I hope we captured that whole range of actions from that, and thank you again to everybody who's worked on that paper and the joint statement. That brings us to the end of the planned agenda. I'm not aware of any items of any other business, so thank you again, everybody, for your attendance and contributions. And we're not due to meet again until the 3rd of March, so I wish people the best possible Christmas and restful and peaceful period between Christmas and the New Year, and look forward to seeing you all in the New Year if those we don't see before then. Thank you very much, everybody.